I hope you can all hear me. Welcome everyone to the first day of our conference. I'm super happy to welcome you all. We're really overwhelmed by all the high numbers of registrations. My name is Luca. I'm part of the CoronaNet research project and also a co-host of this conference. Before we start with our first introduction or the opening remarks, I just wanted to say welcome and thank you for joining today's session. This is a webinar, which means that you can always ask questions in the chat or via the Q&A. The panelists or the presenters will have the chance or the opportunity to see your questions. Due to the time schedule that Cindy is about to present soon, we will not have time for questions during the presentations, but rather in the discussion part. And please bear with us. This is also the first Zoom webinar that we are organizing. So if there are any technical issues, feel free to reach out to us either via Zoom or just by writing us a mail. The meeting will be recorded and will also be made publicly available the first day, the second day not, but this is what I'm then going to talk about tomorrow. So today will be recorded. If you don't wish to be recorded, please don't turn on your microphone or your camera. We are a bit time constrained. We are a bit sorry that people from New Zealand might not be able to join us or just for a part of it. And from Australia, this is just like a really global effort we all have. And although there are many great advantages with these Zoom conferences and virtual meetings, there are also downsides saying that we were not able to accommodate for our time slot wishes, but nonetheless, we are really happy to start this conference. And by starting, I mean that I am really happy to welcome Professor Tim Büte, who's at the chair for international relations at the Hochschule für Politik at the TU Munich, and also part of the Periscope project coordinating this on behalf of the TUM. Tim, the stage is yours.
Thank you, Luca. It's my great pleasure to welcome you all. On behalf of the Hochschule für Politik, the Integrated Political Science Department and School of Public Policy, which was relaunched here at the Technical University of Munich about 4.5 years ago. I do so also on behalf of the TUM School of Governance and TUM School of Management and the future TUM School of the Social Sciences. I'm thrilled to have a chance to say a few opening remarks, both in my role of Dean of Research for the TUM School of Governance and in my role as Chair of International Relations, which gave me the chance to see close up the initial steps that Cindy, together with a couple of colleagues from NYU Abu Dhabi initially, and then with a quickly growing group as early as late March of 2020 launched, which grew into CoronaNet, soon joined by Luca, who has played a really central role in this as well. There are many challenges that COVID-19 presents us with. One of them surely is that there are a lot of things that seem to be different about this pandemic from at least some of the best known previous ones. But one of the key challenges also is that it's really hard to learn from previous episodes of pandemics that seem in many ways quite comparable because we have such limited and often quite poor data. This is, of course, so part of a larger challenge that we face in the empirical social sciences and in any project that seeks to generate original data, to do so in such a way that the measurement that we generate are of high validity and high quality, that the work we're doing is replicable, and that the data that gets generated actually is comparable across space as well as over time. And so this particular effort, in which many of you on this call today will have an active role in the next couple of days, and many more have had already for many months an active role in generating data through various data gathering efforts. And I think it's just a fantastic idea, and I'm really delighted that Cindy and Luca have taken the initiative, and that all of you who are participating today have agreed to come together to share experiences and try to learn from each other, and maybe over the course of the next couple of weeks arrive at some common solutions to a number of the sort of practical and scientific challenges that are involved in these data gathering efforts, so that we can work in a maximally complementary fashion and generate data that is going to be as useful as possible and of high quality, so as to help generate the kinds of insights that are going to really advance social science research and more generally research around COVID-19. Without further ado then, I want to turn it over to Cindy Cheng, who is going to give the sort of substantive opening remarks. Welcome, everyone.
Hi, thank you, Tim. That was very nice. Hi, my name is Cindy Cheng. I'm a postdoctoral research fellow at the Chair of International Relations, which Tim holds. And I really would like to thank him for the kind words that he just said now, as well as his strong support for the CoronaNet research project, for which I'm a principal investigator of. But in these opening remarks, I don't want to speak from the perch of CoronaNet, but as the co-organizer of the COVID-19 PHSM Data Coverage Conference. I've had the pleasure of co-organizing this conference with a number of colleagues from ACOPS, Oxford Blavatnik School at Johns Hopkins, the Complexity Science Hub Vienna, and the Oxford Super Tracker, and hopefully you'll hear more about them soon. When we issued this invitation, we had no idea what would happen, and we've been truly amazed by the response that we've gotten. Almost 300 people in total have registered for this conference. I see that we have more than 100 people with us now. So we have representatives from more than 30 trackers here today. And we've also generated significant interest from a number of different stakeholders, from researchers to public health bodies, to students and concerned citizens. The number and diversity of people gathered here today really speaks, I think, to the importance of this data. So COVID-19 public health and social measures data, and the need for such a conference. And before I forget, I want to take a second to thank Luca Messerschmidt for pushing this conference forward, as well as our student interns, Annika Kaiser, Cleo Bogley, Ezgi Kaki, for helping us organize it, and also a special shout out to Stephanie Alt-Berkman and Verena Anna at the Complexity Science Hub Vienna for their input and help. And of course, the support that we've gotten from the Periscope project at the EU. As you might have surmised, this conference is a little bit different from the norm. Like any good conference, we hope to bring together great people who are working on an important issue. In this case, data collection and research with regards to COVID-19, so that they might be able to share their experiences and their insights with each other. What is a little bit different here is that we're trying to see to what extent we can go beyond just sharing knowledge and work towards a common goal of documenting data on PHSMs as quickly as possible, with as much rigor as possible, while minimizing duplication of efforts and maximizing data completeness. Why should we do this? So, I mean, I think it's pretty simple. To date, more than 2.3 million people in the world have died due to COVID-19, but the distribution of deaths has not been equal. 465,000 of those deaths were people who lived in the United States, while Taiwan has counted around 9 deaths. In short, we know that PHSMs matter, but what policies governments implement, when they implement them, in what mixture, in what context they implement them, all of these details are important for understanding which government policies are effective at stemming the spread of the pandemic. And we will not be able to have a full understanding of this without good data. The value of this data is not limited only towards what it can tell us about this pandemic, but what it can tell us about any number of research topics, including policy diffusion, mental health, climate change. The sky's the limit. And given the enthusiastic response from so many of you, we're definitely going to plan a second conference in the summer, which focuses on what findings researchers have been able to make from the data that we have all collected. But we're here now, and we're far from out of the woods. It's amazing that vaccines are here, but the pandemic is still not under control, and what we know about this new virus mutation is worrying. In organizing this conference, we think that the best way forward is to facilitate, as much as possible, cooperation among all groups that are collecting COVID-19 PHSMs data, not just with the co-hosts, but between different groups as well. I can only say for myself that the experience of co-organizing this conference with the other co-hosts has been really inspiring, and I hope that this spirit of cooperation can extend to all conference attendees. But like everything about this pandemic, this conference is definitely a first for us. And I hope that we can all approach it together with an open mind and figure it out together. So we've tried to structure the conference to facilitate the exchanging of ideas and experiences and to promote cooperation so that we can work towards this common goal of collecting complete, clean, and comprehensive PHSM data. Today is our Get to Know You Day. Trackers can introduce themselves in terms of not only what they're doing, but to the public at large. So in the first session, we have a big Tracker Roundtable where the co-hosts will give an overview of their projects, followed by a second special Tracker session where invited trackers will tell us more about themselves. Finally, we'll have a wrap-up session with Lucas Lehner, the creator of the Oxford Super Tracker, who will synthesize the findings from the first two sessions, followed by a Q&A. Tomorrow, we will limit the conference to only the trackers themselves so that they can discuss in more detail what challenges they face and how cooperation and collaboration might help them overcome them. Given the time constraints with so many trackers and so many time zones for this virtual conference, we had to choose between getting to know a few trackers a little bit better or to risk superficial introductions of all trackers. So this is how we decided to organize the conference, but we definitely want to make sure that everyone can talk to each other. To that end, we prepared an interactive tool to help facilitate discussion for these panels so that in the second half of these first two sessions, everyone can share their challenges. And special thanks to our EU partners at Periscope for the use of this tool. In the last but most important session of the day, we will all brainstorm together ways in which we can collaborate. We definitely recognize that real collaboration and integration will be hard. We have to make sure that we're not duplicating efforts, but that we're not just duplicate, or not that we don't duplicate efforts, and that we don't, that we cover as many gaps as we can. It requires that we hammer out the nitty-gritty details and build trust among the different groups who are willing to participate. Realistically, it requires more time and effort than any tracker could have reasonably been expected to commit ahead of this conference. As such, we structured the conference so that there's 3 weeks in between the first 2 days and the last day of the conference, which we hope will help us identify and establish this common ground to work together and build trust. So you'll notice that the last session of the conference day is a bit sparse. This is on purpose. We'll organize it hopefully with the input of invited policy trackers once we know the outcome of the first 2 days. Whatever happens, we do aim to explicitly invite funding organizations, international organizations, and the media to this last day so that we can present to them the outcomes of our discussions about cooperation, what challenges we still face, and how our experiences may help with future pandemic response. Before we move on to the main show, I just wanted to say that I'm so grateful that so many of you could take your time to attend this conference now, given that we organized it rather quickly. Everyone has done an amazing job collecting data on COVID-19 PHSMs, and we're honored that you could attend. It's funny that the pandemic has made it so difficult to see those who are closest to us, but surprisingly has also given me, at least, the chance to make unexpected connections with those who are also collecting data on COVID-19 and to figure out how we can work together. In this moment now, I have no idea what's going to happen at the end of this conference, but as long as we can continue to build new connections and to find common ground, I'm sure that it'll be a success. So I'm going to hand it off to Luca and Alex, who will be moderating the first day.
Yeah, and I'm just here to hand over to Alex as well and to turn off the microphone here. Alex, you can go ahead.
Thanks, Luca. Thank you, Cindy, for the great introduction, and thanks, Luca, for handing over. So I'll be moderating the first session of today, which is an hour and a half and runs until 4:45 in CET time, and is the big Tracker Roundtable. So the broad aim of this session is that it's an opportunity for the big data trackers, the big trackers of the government measures data, to share knowledge and experiences from the past year and from their experiences of collecting data. So we'll go through each track in turn, and each tracker will discuss aspects of their data collection efforts, share what organisational, motivational and other challenges they face and have faced, maybe how they've overcome certain challenges as well, and provide an outlook of their future plans. So we're rather time tight on this session, but we'd like to hear from each tracker for 12 minutes. And I'm afraid we'll have to be rather strict on timing so that we don't overrun into the next sessions. So if we could hear from each tracker, that would be great. We'll go through alphabetically, and I'll let you know when you're near the end for your 12 minutes, or when you've gone over 12 minutes maybe. So starting alphabetically, if we could hear from ACAPS, from Angeliki at ACAPS, that would be great.
Hello everyone, this is Angeliki Nika from ACAPS. Thank you very much for attending the conference today, and many thanks to the team of CoronaNet, and especially Luca and CD for the organization of the conference. One question I have is if I can share my screen so that I can share some slides with the participants. For now, I'm not able to do it. So first, while I'm waiting to see if I can share my screen, I would like to give you a small introduction on what ACAPS is and the work that we do in general. ACAPS is a humanitarian organization, and our main goal is to provide information that enable decision makers in the humanitarian sector to make more informed and evidence-based decisions. Our work on the government measures dataset started at the very early days of March 2020, right after the declaration of the pandemic of WHO. And the starting point for our engagement and our work on that was a request from WHO to start monitoring the different measures countries are implementing, with the goal to be able to inform the humanitarian community on what the different types of measures are and how they could possibly affect the humanitarian response in different countries. I see I can share my screen now. So I hope you can all see my slides.
Yeah, we can.
Thank you. So the work, the starting point for us, as I said, was the request from WHO. The setup of how this data set started was very quick. It took us overall 5 days to bring together a team of analysts and start collecting the first data. And the method that we applied is a more or less standardized method for data collection. ACAPS is applied to all our different products. In general, we have a human-led approach on our data collection. That means that although we use a lot of digital tools, we make a priority on analysts that have the knowledge of different countries to bring together a lot of different information, either from published by governments, humanitarian organizations, or other agencies, and apply expert judgment and mixed method approach to our data collection in order to produce both comparable global data sets, but also analytical reports, and go in details into our data to make it into useful output for decision makers in the sector. As I said before, the team that started working for that was a very small team. We were only 4 analysts at the early days of the data collection. We immediately went global, so the first data set that we published was already covering more than 190 countries worldwide. And we started with an inductive method. That means that we did not have a set analytical framework when we started, and we did not start from working on the analytical framework, but we started from coding the data and categories of different government measures emerged as we went along with our coding. What we ended up with was a quite long data set on the very first days, already covering 34 different types of government measures across 5 different categories. That was the very first early days, and that of course came with a big set of challenges for such a small team. Very quickly we saw the interest on the government measures dataset picking up, and the first step that we did was to start to think how are we going to improve then the data that we collect. One of the first things we did is that we started looking critically at the framework that we had built with this practice method. We worked closely together with colleagues from CDC, the Joint Research Center of the EU, as well as WHO, to build a framework of government measures that would actually fit also the way that they were looking into the different measures and the analysis that they were doing to fit into the different types of response. That's how we came up with the final analytical framework that I think I'm not going to talk about it in detail now, but we will have the opportunity later in the conference to look at it. Of course, this brought a very big set of new challenges because every change that happens in the analytical framework then needed to be reflected in the data set. This led us to a lot of recoding of information, looking deeper into some of the categories of government measures that we had identified. Then the second step that we took was to actually start expanding the data collection. By expanding the data collection, we brought together a team of volunteers. Most of them were students from the University of Copenhagen at different levels on their academic work. And these volunteers, they helped us by doing the big majority of coding for the different countries, including the dataset. The third step about that then we took after reviewing the framework and expanding the data collection and building a new team was also to think about how do we make our information and our data accessible to the biggest audience possible. And this comes back to a common challenge that we have within the humanitarian sector about how do people access the different data, also depending on the capacities that are available in the sector. We try to adapt to that and make the dataset available in as many different ways as possible. So first of all, we of course shared an Excel file with all the coded data and we try to make it as transparent as possible, including all of our sources. Some notes that the analysts and data collectors were taking while compiling it. But very quickly we saw that this is not enough for many reasons, because the Excel file may be very easy to use, but more advanced and technical users, they needed to access the data in a better way, on a more real-time way. That's when also the team of data scientists of ACAPS came on board, and I think you will have the opportunity to hear from them later in the conference, and they helped us build the database that later hosted the government measures dataset and is now hosting all of the ACAPS datasets, as well as the API to make the communication of the information more efficient. Apart from that, we also worked in cooperation with MapAction, and we developed a dashboard to be able to communicate and present our data in a more user-friendly way. And here you can see an example of this dashboard, and I think it's still online now with a full data set that we published, and you can access it on the ACAPS website. And you can also see here the address of the API that the datasets are also accessible. A next step after we took all those steps to improve the dataset was to look actually into our impact. The dataset itself had a huge impact on ACAPS. It had a huge impact on us because it was a work much broader than what we usually do. Usually we are very focused on informing humanitarian responses and providing data for humanitarian operations, while the government measures dataset was much broader than that. So very quickly we saw our user basis to be expanded significantly. Here you can see in this graph the impact actually that it had on our website traffic, where you can see a almost tenfold increase in the daily traffic to the ACAPS website because of that. However, what was very challenging for us, and this is a common challenge that we have, I would say, for most of our products, is to actually be able to assess the impact of the data. And this is something that I also hope that we can hear also from the other trackers present in this conference about how do we actually measure the impact that we have in our data? How do we measure? How do we see different user cases, and how are data eventually being used? One thing that we always try to do is to collect as much feedback from our users as possible. And what we saw is actually the data set has been used by many users from the humanitarian sector, the private sector, but academia, and it informed a lot of decision-making models. A good example is the model built by UN OCHA to inform the planning on the response in COVID-19 humanitarian crisis. And I think you can see a good example of that on the data center website of UN OCHA. But it's an ongoing struggle, I would say, for us to learn how this data set is being used, along with the other data sets that we produce, how people make decisions out of the information, and how do they turn a data set into action and into actual decisions. One thing I would like to finish with is also about an explanation of where we are right now and what are our future steps. ACAPS, apart from the government measures dataset, at a later stage worked on the COVID-19 secondary impacts dataset. We applied a similar logic in the data collection. And our aim on that was to look into what are the impacts, the hidden impacts of the pandemic, but also the hidden impacts of the government measures themselves, looking at different sectors such as health, economy, migration, and education. Unfortunately, at the end of 2020, we had to conclude the data collection in both those datasets, both the government measures dataset and the secondary impacts one, due to significant funding constraints that we had around them. Currently, we are in the process of transitioning our data and incorporating our data to the Corona network. And I think we will have the opportunity to talk more about this later in the conference. And our main goal is to be able to ensure continuity for our users. For those datasets, we have identified a huge user base, around 40,000 downloads alone for the government measures dataset. So you also understand it was very important for our users, and it still is, to be able to inform the models that they build and to keep informing the decisions they take based on solid data. This is one of the reasons I'm very happy that we participate in this conference, and I'm really looking forward to see the next days and the outcomes that we will get out of this. Thank you very much.
Thank you so much, Angeliki. That was great. So thanks for the overview and the summary. And next we have CCCSL speaking. So if I could hand over to you, that would be great.
Hi everyone, I will share my screen here. Okay, could you see it?
Yeah, we can. Yeah. Thanks.
Okay, super. Dear trackers, dear attendees, good morning, good afternoon. I am Amélie Desvers-Larive and I will present the Complexity Science Hub COVID-19 Control Strategies List, or CCCSL. It is a collaborative project initiated and led by the Complexity Science Hub Vienna and supported by the University of Veterinary Medicine Vienna, Austria. I will present you why we started this project, how we have proceeded to build up our dataset, and what's the foreseen future of it. If you remember back in March 2020, one of the biggest questions at the time where the different countries were implementing different policies with a different timeline, with a very uncoordinated strategy, was which strategy worked the best. And the Complexity Science Hub wanted to tackle this question. However, the key requirements to assess the effectiveness of the interventions are, first of all, we need high-quality data on cases, and second, fine-grained data on government interventions. And at this time, we had here a data gap. Therefore, we decided from March 2020 to generate a comprehensive and structured data set on government response to COVID-19. From the very beginning of our project, we wanted it to follow the open principle, the open knowledge principle, and be shared widely. We wanted the dataset to be readily usable for modeling and machine learning purposes. Therefore, we have built an inter and multidisciplinary team. The first question we have asked ourselves was, which types of interventions should we collect? Then the answer was any kind of intervention related to response to COVID-19. So we have looked at press releases, but also literature on non-pharmaceutical intervention implemented in response to influenza. And based on expert knowledge, we have identified 8 major themes in which we could classify the different interventions implemented by the government. They were related to case identification and contact tracing and tracking, but also environmental measures, measures related to healthcare and public health capacity, resource allocation, risk communication, social distancing, travel restriction, and what we have called returning to normal life, meaning relaxing of the measures. So as you can see, we have mostly public health and social measures. However, in the resource allocation teams, we also have collected economic measures. Which data source did we use? So we are using only public sources like official government web pages, press releases, newspaper articles, or government communications through social media. We have asked our data collector to collect the following data. First of all, where the measure is implemented, the geographical unit. Is it a national measure, a regional measure, or maybe implemented in one city? Then, of course, we wanted to have the date of implementation. And we have asked our data collector to collect the raw description of the intervention as it is described in the source, but translated in English. We wanted also to collect, of course, the source of the data, and we have added a bit later in the project the status of the measure, meaning is it a new measure or is it an extension of an already existing measure? We wanted to code the intervention using a taxonomy in order to standardize the description of the measures and to obtain a structured data set. For this, we have used a content analysis strategy of the information sources, which has enabled us to systematically transform the large amount of text that we found in the sources into organized and concise summary of codes. Our taxonomy consists in a hierarchical coding scheme, including four levels, and each intervention is assigned to one of the 8 themes that I've described before. Then the description and the specification of each intervention is then coded into category, subcategory, and codes. For the different coding, we use words or short sentences. Therefore, they are readily understandable even for non-experts. All our data are hand-coded. All this code results in what we call a master list of codes, gathering all the available code to describe the interventions. This master list of code is a dynamic and flexible document. Indeed, while coding the data, there's a lot of emerging codes that coming from the text source, and we have regularly to merge the redundant codes. I will present you how data is flowing in the project. Data collector collects data, if possible, in the native language. If not, they use Google Translate. We ask them to put all the source in a Zotable library, which is available online and publicly. We have trained the data collector to code the data. So our data collector are also data coders, and they use a 4-level coding scheme. Once they're ready with a country, they send the table for a country to the data manager, including the emerging codes. Using B and multi-directional exchange and feedback, we can complete the data or specify what is missing or not clear. Then the data manager updates the master list of codes on a daily or weekly basis and share it on Google Drive so that the data collector have an access to it, to the updated document. The data manager then validates the data and curates the code manually. Data scientists then intervene and do the curation of the code using computational technique. They also check for programming language interoperability, and from the very early steps of the project, we have also developed visualization. And again, we use feedback to exchange and improve the process of the data collection and coding and curation. Once ready, we share the data set on an open source repository, GitHub, but we also share it on Google Drive. During the first month of the project, we have heavily relied on the pro bono work of more than 40 volunteering contributors in the network and extended network of the Complexity Science Hub. From November 2020 and until the end of this month, we are funded by the European Open Science Cloud, which enables us to employ 3 scientists. This is a milestone, the main milestones of the CCCSL. We have released the first dataset on 2nd April 2020, 2.5 weeks after we started. And at this time, it covered 52 countries and a bit more than 2,000 interventions. We have published the dataset and the method in Scientific Data end of August. And at this time, it included 56 countries and a bit more than 6,000 records. As of today, the dataset covers 57 countries and 10,300 interventions. As you can see, we do not cover all the world and all the countries, and we are mostly collecting data for European countries with 34 countries from the European region. And we would have liked to collect more data on developing countries, but it was not possible. Joining the global effort to fight the pandemic, our dataset has been integrated into the global dataset of public health and social measures aggregated by the World Health Organization, together with other initiatives that worked on the topic. And if you remember what was our primary objective, we wanted to assess the effectiveness of the measures. And together with the Sapienza University in Rome, the University of Veterinary Medicine in Vienna, and the Complexity Science Hub, we have published this paper that I will not detail here, but yes, we have reached our primary objective. What are our challenges? First of all, the amount of data that has to be collected is dramatically increasing, and we are a small initiative and we are lacking workforce. The flexibility and the dynamic characteristic of our master list of code were the strengths at the beginning, and it's now a limitation because this document has to be updated regularly, and with the amount of code we have now, it starts to be quite hard to do it on time. What are our perspectives? First of all, we want to value the work done and the data collected. We publish a clean dataset that can be used on its own. Moreover, we would like to increase the data availability and data access, and we would like to make our data accessible in different formats and platforms to enhance use. So we are already integrated in the WHO PHSM global dataset, but we are thinking now about completing other trackers, and we are developing an algorithm which will enable us to code our dataset using the taxonomy of another tracker, and this algorithm could work in both ways in a win-win process. And we are currently collaborating with CoronaNet on this project. We are facing several challenges. And it's time to end my presentation now, but I would like to warmly thank all the contributors and collaborators who participated to this project. It has been an honor to lead the effort and to work with all of you, and I thank you very much. I also warmly thank the Complexity Science Hub Vienna, who has motivated and highly supported this project, and the University of Veterinary Medicine Vienna, and of course our sponsor, the European Open Science Cloud. And I thank you very much for your attention.
Thank you so much, Amélie. That was a really, really interesting presentation, and thank you to you and your team at CCCSL. Okay, so if we can now hand over to CoronaNet to talk about their project.
Hi again. Can you all hear me?
Yeah, we can. Yeah.
Okay, great. Hi. So I'm excited to now present the CoronaNet research project to you all. As I emphasized in the opening remarks, whatever research or insights that we can derive as to the drivers and effects of the COVID-19 pandemic will depend heavily on the availability of relevant data. So this begs the question, what can you do with the CoronaNet data? Our taxonomy is very fine-grained and allows for a number of different types of analyses. For instance, you can make cross-national comparisons of PHSMs, drivers, and effects because CoronaNet data tracks government policies in more than 195 countries. So one could use the data to ask, for example, how effective was Russia's policy response compared to other countries? You can also do an analysis which takes into account the multi-level nature of government policymaking, because our data captures subnational policies as well. So, for example, you might be interested in looking at our rich subnational data for Russia and ask how effective is a decentralized versus a centralized approach to PHSM policymaking in stemming the pandemic. Maybe you're interested in conducting a network analysis of COVID-19 PHSM data, drivers and effects. So you can do so using the CoronaNet data because we document data on geographic targets and policy directionality. So in this map, you have the origin country as Russia and the target is China. There's been a border policy that Russia has made against China. You can thus ask, maybe is Russia more likely to implement a border restriction if the United States implements a border restriction against China? But maybe you're also interested in doing something which looks at how the pandemic affects a particular population. Because we also document information as to the demographic target of a policy, you can answer a question like, is a policy which gives priority to people older than 75 for getting a COVID-19 vaccine more effective at stemming the pandemic than a policy which gives priority to essential medical workers? So I hope this gives you a better idea of what kind of analyses are possible with the CoronaNet data. For the rest of the talk, I want to give you a better idea of the scope of the data set, the policy taxonomy, how we're organized, who we are, and who we're partnering with, and our next steps. So just to give you a brief overview of the scope of the data set to date, we've collected more than 58,000 policies. We've done so for 195 countries, and we also make a systematic effort to document each subnational unit at the ISO 2 level for 12 countries. So in total, more than 400 subnational units. We've been collecting these policy actions for daily data for December 31st, 2020 until the present. And we also have some summary measures. So our policy activity index uses a Bayesian measurement model to categorize countries in terms of how responsive they have been to the pandemic. And we're also working on a new measure which also uses a model-based approach to measure the degree to which government policies restrict mobility. The data is available publicly, and you can find out more about it in our paper published in Nature Human Behavior. To say a little bit more about the taxonomy, so for each policy, we have information about the announced dates, the start dates, the end dates, as well as a textual description, along with information on the following dimensions. So first, the policy types and the policy subtypes. We have 19 broad policy types and more than 100 policy subtypes that we document. So an example of a broad policy type would be a quarantine policy. An example of a subtype would be if the quarantine required one to stay at home or go to a government facility or go to a hotel. We also further document which level of government initiated a policy or which level of government the policy is targeted towards. And this information also captures whether this is at the country level, the provincial level, the city level, or some other level of government. We record information also on the demographic targets. So for example, does a policy affect travelers or residents? On the compliance, so is this a mandatory policy with fines? Is this a recommended policy? And the policy enforcer. So did the Ministry of Education put out this policy, or was it maybe the Ministry of Health? For all policies, we're also able to document updates to policies, for example, in terms of an extension of timing. And we also have information on the raw URL source of the data and the a PDF source as well, or a permanent PDF of the source as well. So just really quickly, these are the broad policy types that we cover, which just in the interest of time, I'll leave for now. I want to spend a little bit more time talking about the methodology in which we collect the data. So in the pre-data collection process, we designed a custom Qualtrics survey through which research assistants or RAs can document policies. We provide these RAs with training on the taxonomy and on the survey. And we've also partnered with 2 companies to help them identify policies to code. So Jadaware is a machine learning company that used our codebook to identify relevant news sources on COVID-19 policies, and Overton does something similar with government policies. In the data collection phase, we have regional managers and country managers who provide guidance and feedback to our RAs, and we have Slack and an internal dashboard to promote communication. And of course, the main event is that the research assistant actually documents the policy in the survey. In the post-data collection phase, we have a cleaning team which cleans the data for logical inconsistencies, typographical errors, and we also have a validation scheme in which we sample 10% of the data. We then triple code that data, and we see to what extent there's agreement among the coders. So if 2 out of 3 coders agree, then we count this as valid. And if not, then a 4th person comes in to resolve the disagreement. And lastly, we then process the data through the raw Qualtrics data and release it publicly. So how we made this work is that we've built a community that cooperates and communicates constantly with each other. So we have 9 PIs and co-PIs from institutions all over the world. But I want to make sure that I spend some time talking about our amazing volunteer research assistants. We have now more than 600 working with us. In the past 2 months, we've been onboarding around 30 a week. And they are truly the lifeblood of our project. I'll say a little bit more about how we're organized internally tomorrow. Here's on the screen is just an overview of the different teams and structures that we have. But I wanted to just say on a personal note, we created this data set for researchers and policymakers to use. And this is still the primary motivation of the project. But we've also come to realize that many volunteers have found the project to be a really productive outlet, especially for dealing with the uncertainty that COVID-19 has brought to everyone's lives. And yeah, that's just to say that participation in the project has already had a positive benefit on the people involved in it, myself included, and yeah, beyond the main benefits that making this data publicly available provides. Aside from our great internal community, we've also been really lucky to have very supportive external partners. So aside from our partnerships with Overton and Jadaware, our biggest partner is Periscope. So Periscope is a consortium of more than 30 European academic institutions. It's been funded by an EU Horizon 2020 grant. And as part of this consortium for the next 3 years, we will be working with social scientists of every stripe and color to support research on the behavioral and social effects of COVID-19. And the CoronaNet data in particular will be incorporated into the Periscope Data Atlas, which will bring together data not just on PHSMs, but any type of data relevant to the pandemic. In addition, we're working with the IFO Institute, an economic think tank here in Germany, on visualizing the CoronaNet data. And we've been supported early on by internal funds from the Hochschule für Politik, where Luca and I and Svanhilde are, and from the NYU Abu Dhabi internal funds, as well as external funds from the Leibniz Institute, for which we're very thankful for. We're also really excited about new partnerships that we've made with fellow policy trackers. So we started reaching out to many of you in November, as many of you know, and we did so because as much as we've been able to do so far, we know that we can do better to improve data coverage. We know that we can do better to improve data quality, and we know that we can't do it alone. So we're really happy to say that one of the outcomes of these talks is that we've reached bilateral agreements with ACAPS, Triple CSL, HIT COVID, and CIHI to integrate their data. We plan to do this in data integration country by country, or in CIHI's case, subnational unit by subnational unit. This is because in our experience, the policy history in any given country can be quite complex. And it's important to have research assistants, many of whom have spent many months accumulating substantial knowledge on the policy history of any given country, on board so that we can have a true integration of data and avoid duplication. We're also very excited about our cooperation with the Oxford Group in creating a taxonomy map between our two data sets. And I'm sure that the outcome of these cooperative efforts will be more than just what we've listed here. I'm also very excited to hear more from all invited trackers here today and to hear what you're all doing and to see what next steps we might take together in order to get this high quality data on PHSMs as quickly as possible. So thank you.
Thank you so much, Cindy. That was great. And also you were like perfectly on time, which was impressive. So next, if we could hear from HIT COVID as the penultimate tracker, that would be great.
Yes. One second, please. Just setting up. Yes, so good morning, good afternoon, good evening. Really, thank you very much for the invitation today. My name is Alex John-Sapp, and I will introduce you now to the Health Intervention Tracking for COVID-19 HIT COVID project at the Johns Hopkins Bloomberg School of Public Health. And here with me today on behalf of our team are Han-Mang Zhu and Sophia Zweig, my colleagues. So first of all, I will start with giving you an introduction to our team. So here's a list of our PIs, our staff members, and we are also very grateful for our donors that make this work possible, including the Johnson & Johnson Foundation, as well as the Johns Hopkins University Office of the Provost. I will now provide you a brief overview over our data collection efforts. So we collect data on the national and subnational level. So subnational in this case means administrative level 1, such as states in the US or other regional units in other countries. We are staffed by over 200 global volunteers that get assigned to these geographic units, even though there's a caveat to this, which we will get back to later, since this number is fluctuating over time. But these volunteers get assigned to a geographic unit, which can be either a country or, for specific countries, larger countries such as India or the US, we also have subnational data. So then it goes down to the state level usually, or other such as province. Then the data is entered into RedCap, a RedCap platform online. So RedCap is a quite common tool used in public health and global health. And usually our volunteers are trained weekly, or in the beginning there were weekly orientation meetings and weekly office hours. And the protocol involved, first of all, technically constructing a historical timeline by retrospectively adding the PHSMs that have been entered to that moment, and then prospectively from that point on going forward, entering
PHSMs that have been reported over time. And also really important, we have an option to enter no updates. So that's kind of a negative feedback that is really important to just provide us with the information that there's literally no data as opposed to just not entering data. In terms of quality checks or quality assurance and quality control, we have internal audit reports that get sent out weekly. And there's also a change request form or option. So if volunteers realize that they erroneously coded something or that something might be wrong or missing or there needs to be an update, they can request to change that retrospectively and then correct or validate that. For external communication, presentation, we both have a website as well as openly accessible GitHub repository, and we are an ongoing contributor to the WHO PHSM data set, which has been mentioned before by our collaborators. Here's a list of the PHSMs that we are covering in the database. So we have some broader on the left, broader, more frequent ones, such as border closures, symptom screening, quarantine, self-isolation, household confinement, school closures, but also some more public health specific ones, including contact tracing, testing, or mandated face mask use or universal face mask policies. And on top of these individual categories for each PHSM, we not only assign the country or the subnational level if applicable, but also an implementation status. So that usually includes the start date and end date if it's stopped. And it's quite specific to HIT. We have a stringency measure. So we categorize either into strongly or partially implemented, or if an implementation was suspended. So if it's not longer, no more being implemented. We also have a geographic scope, which is a bit different than the country or national level. It's more trying to clarify, is this a nationally rolled out policy or a policy that refers to a specific geographic subpopulation? And then we have a non-mandatory, so optional field on providing details on the policy and the intervention. And we usually ask our data volunteers to enter both the URL and the source documentation in form of uploading a PDF document, if that is possible, in case the URL becomes invalid over time. We prefer official government documents, so either the overall government or public health agencies or the Ministry of Health or other ministries or agencies in the government of a country. If that is not available, we usually refer to secondary sources such as news media, which we then try to corroborate or to double check so that there's multiple consistent reports on the policy. And I will now pass on to my colleague, Sophia, who will give you some more detail on the geographic coverage.
Alex. So our database currently contains policies in over 3,500 subnational units in 242 countries and territories. Here you can see a map with an overview of policies that are at the national level or at the subnational or admin 1 level, color-coded by those descriptors. Next slide. So some of the challenges that we're currently dealing with are really due to the progression of the pandemic. Our biggest challenge is probably in our volunteers. Issues such as burnout, lower engagement, lack of motivation are resulting in a lot of our volunteers dropping off, as each week we tend to only have about 20 to 30 active volunteers compared to the original 200 plus that we had. And we have fewer volunteers signing up every month to join on with us. For this reason, we're having some issues with our capacity for data entry among our staff alone and our management team alone. So for this reason, we are currently in the process of hiring a new staff member to assist in data entry. And because of the previously mentioned drop off of volunteers, we also deal with a lot of non-responsiveness from our volunteers, which makes it hard to reassign countries to which volunteers have stopped contributing. Next slide, please. Some of the resources that we have are a publicly available website on which we present a timeline of all the public health and social measures, as well as a map in which you can filter the different public health and social measures by country. And the graph on the bottom left that you see there is a timeline from our website. Every week we send out automated data update reports that include visualizations and maps. And the map on the upper left is from that weekly data update report. And you can see the progression of the database over time. We published a descriptive research paper in the journal Scientific Data on our methodology and database. And all of our code is publicly available on GitHub. Additionally, our team designed a package in the R software program that allows you to examine the data. And I will now turn it over to Han-Meng to discuss the R package.
Okay, thanks, Sophia. So as a member of the team, I'm going to give a brief introduction of our R package. Next slide, please. So to allow public to access and use the data of the HIT-COVID database, our team has actually developed an R package as shown here, the HIT-R-COVID package, which is open to public on the GitHub through this link. And it's also on our website so that you can access it. So we recommend users to take a look at this package because we think this is a very handy tool to get a sense of how HIT-COVID database looks like and what information we are capturing and how the data are actually stored in the database. And there are two groups of function in the package. So first is to help with pulling or filtering the data, and then is to visualize the data. And next slide. So the first two of the function allows for pulling the up-to-date and clean version of the HIT-COVID data, and then filtering it by user's interest. For example, like to filter out the data for a specific country or region or for a single type of intervention of interest. Next slide, please. And the second group of functions are to visualize the existing data in the HIT-COVID database. Next slide, please. And here are a few examples. And this one on the upper right is to visualize all the policies of PHSM that have been entered into the HIT-COVID database here, specifically for 2 countries. Sorry for being so small. And compare them in parallel. And then the one on the bottom right is a world map showing the status of a certain PHSM at a specific time point. For example, for a PHSM like mandatory mask wearing, some countries or regions are strictly requiring that, while some are just recommending it. And also for some, we don't quite know because of lack of information. So this map provides a snapshot of the status for each type of intervention at a desired time point. And this next example is aligning the epidemic curve of a country with the timeline of PHSMs during the pandemic. So this is a very straightforward references to use as a first step, looking at maybe possible relationship between certain PHSM and the pandemic trajectory. So, okay, I'll hand back to Sophia.
Our future plans hinge on our upcoming integration with CoronaNet, which we're very excited about, which we hope will help keep our database alive and usable if our funding runs out. We've narrowed our focus to primarily the African continent. So our new staff member who's going to be responsible for data entry will be focusing on African countries. And we hope this will bring more data on lower and middle income countries to the PHSM data sphere. And we're also in the process of updating a new question on vaccine policies. And a side project of ours that we're excited about is our health equity project, in which we're trying to come up with some global health equity measures that we can tie into our HIT-COVID data to provide more information for researchers interested in focusing on health equity. And that's everything we have for today. Thank you all.
Thank you so much. That was really interesting. And Yeah, that was great. So if we could hand over to our last tracker, which is OxyGRT. Thank you.
Okay, that should be working. Okay, so I wanted to just start off by thanking Cindy, Luca, and everyone. It's really great to see other projects here that we've spoken to over the course of the last almost year. And also just to reiterate an appreciation for the spirit of this meeting. Now, my task is to give you a broad overview like the other presentations, you know, many of the experiences and challenges that the other projects have talked about, we have shared as well, training coders, reviewing data, and so on. So given that O is for Oxford is rather late in the alphabet, I thought I'd carve out some of the 12 minutes to actually show you a few more visualizations and findings from our project. So to start off, the chief aim of the Oxford Tracker project, like so many of the other trackers here, is really to provide comparable and objective data. And so we, other researchers and governments can actually follow what's going on over time, the different policies that have evolved over this whole pandemic period. So as you'll see in the video, our data goes back to the 1st of January 2020. It's actually published in real time as our coders input the data. And then through the review process, you know, going back about a week or so, that data has been checked by at least one other reviewer. Now, the data itself is available for free and in a time series format. And the idea of that is really to make it as easy as possible for people to use. It comprises about 20 different individual policy indicators. And we think of those in 3 categories. So we have our closure indicators, the schools, transport closures and so on. Health indicators such as facial coverings, contact tracing and testing. And notably, quite recently, we added a vaccine policy indicator and economic indicators as well. And so we record each of these at different levels or degrees of policy strength, rather than, if you like, the mere existence of policy or not. And so they're coded on ordinal scales and where appropriate on continuous scales. And even for the international data set, we code whether a policy applies over the entire geography of a country or is targeted to a particular region. And so we combine, if you like, selections of these 20 different indicators in different ways to create indices. And I think our project is probably best known for the stringency index, but we actually put out 3 others currently. And the aim of each index is really to give a general measure of policy strength in a certain area of policy. So for example, we have an economic support index, which combines 2 kinds of economic support for households, so income support and debt relief. And whenever our coders input data, we have them also write some notes about the policy and include archive links. And we found the archiving is actually incredibly important if we want to go back and check, or if qualitative researchers want to dig into our data set. We're currently collecting data for more than 190 countries, and we have subnational data, data going for the US, Brazil, Canada, and the UK. And we're adding at the moment India and China behind the scenes, and Australia. Now, reflecting back on the past nearly 11 months, I think we've all learned a lot about citizen science. And when Cindy was talking about, you know, how much it's all of this work and this project and the pro-social nature of it has affected her personally, I think, you know, that's absolutely something that a lot of us, you know, identify with. This project really emerged out of seminars taught at the Blavatnik School of Government. So Tom Hale and I teach a course called The Politics of Policymaking to graduate students. And nothing would be possible without our volunteer army, and that grew out of the graduate school, the graduate community in Oxford. The key to trying to keep all this going is absolutely keeping this army happy, so culture, so nurturing, if you like, their sense of public service, which is really what's motivating the contribution. And where possible, we've tried to involve coders in substantive outputs other than core data projects. I think it's probably also worth noting that over the course of building up, particularly the subnational coding, we have joined forces with several groups along the way who have been using our codebook independently. And there's a huge opportunity here. It's also quite a difficult thing to do, even when you're working from the same codebook, because there are really difficult details around edge cases and different ideas about which kind of sources are acceptable, but it's still a very, very worthy aim. Now, to quickly show you a few patterns in the data that we've found, this is using our international data set. And we have here different world regions. And so the intensity of colour shows the strength of our containment and health index over time throughout last year. So we have time along the x-axis. And now the circles mark the date that a country experienced its 10th death. So you see quite a bit of variation in the timing of those 10th death points. However, when we just focus on the colour and we look at when countries shift initially from grey to red, we see that they almost do that at the same time. And they're doing that really in a fortnight period around mid-March when the WHO announced the pandemic. And so, in other words, we see that even though disease has affected countries at different times, the policies were really brought in at the same time, and that's actually not in line with the WHO recommendations. And so, yeah, those are things I just wanted to point out. Happy to discuss about all of the processes behind the scenes and how we keep the volunteers and everyone else happy. Thank you very much.
Thank you so much. That was really interesting, and really interesting to hear about all the ways you've been using the data. So that brings us to the end of all the trackers. We've actually ended quite early. This session was due to end at 4:45 CET time, and it's 25 past now. So Luca, what do you think? Do you think we should go for a break early or have a Q&A or a discussion?
We do have a Q&A now, meaning
okay.
that you should all see the Q&A button down at your, at the bottom of this Zoom window. You can now start posting questions, and then we can, please, if you would like us to read them out loud, just maybe put in bracket read out. And if you would like to address this question directly, we can, I think, give you the speaking rights. Let me see if this works. I can see Timothy Young, who has a question. Let me try to, no, I can't actually. So let me search for him. Yes, now Timothy, you can speak now if you unmute yourself. I can't hear you. If not, oh, yeah.
Hello, can you hear me?
Yes, we do.
Just a simple question. So I just want to know any trackers here attempted to collect the information about the enforcement of the restrictions.
Hi, Timothy. Yeah, we do collect data on whether our policies are being enforced by police or military, but it's a sub-question. So we don't usually show it in our visualizations, but that's available in our data set.
We also have this variable in our data set, so it shows the compliance and the enforcement mechanism. But as all the other trackers, we do only capture the Euro announcement of policies, right? So not if policies have been, like how good policies have been enrolled, basically.
It's the same also for the ACAPS data. We capture the measures and penalties for enforcement if those were foreseen and published together with the measures, but not actual data on how much a specific measure has been enforced or not.
So just from the Oxford side of things, we don't capture it for the main data set. However, we have been coding it in a lot of detail for Brazil. And so we have 3 different measures of enforcement for every single indicator of the 20, including down to the level of if there's a dedicated team, if the resources have been put behind the enforcement measure, as well as fines and whatever it is.
Also, Chris Grundy has commented in the chat and said that for the WHO PHSM dataset, they also add it to their data.
Do you want to take over, Alex? Do you see the questions, or shall I continue?
I don't mind, either way.
Okay, I can see a question from Katja. Could you reflect a bit on the beginning processes of data integration with the other partners? Are you using certain data standards? Yeah, so I would probably also, like maybe in alphabetical order, just go around and give every tracker 2 minutes, not 2 minutes, 2 sentences to respond. ACAPS, you want it?
To be honest, I'm not sure I completely understand the question. The beginning process of data integration, if it means integrating our data like with each other, this is something that, as I mentioned before, we are in conversations with Cindy and Luca for CoronaNet. Specific data protocols, we have a data protocol that we follow for all of our data set, and this is around data protection, covering data protection issues largely. However, due to the nature of this data collected in the government measures dataset, this is not something that applied in this case necessarily.
Regarding the integration, I can answer maybe because we have started to work on it. So with what we have done is we are trying to map the taxonomy of the CoronaNet with our taxonomy and to see which code correspond to the others in both data set. And we have started with 2 countries at the moment. And we are working on an algorithm, as said before, that could record our data set with the CoronaNet taxonomy. And so we are identifying mistakes and errors now, so we corrected them, we're correcting them. And yeah, I think we are okay now with the two first countries we tried. It just the long process is to map both coding system and to identify which code correspond to what, because we think we're collecting the same data, but we are not. So sometimes what the other collect, we do not, and what we do collect is not collected by CoronaNet. So I think it will be a long process, but it's a very interesting process too.
And I can comment on our data integration process. You know, we're also doing similar work to try to map out our taxonomies, but we haven't actually started in that. What I'm saying is that we're still at the planning stage. So right now we're in the process of comparing our standard operating procedures. We have not started mapping our taxonomies yet, but that's the first step, to map our code books, compare them, try to automate the process using programming. We use RStudio, and try to integrate as many of the fields that are similar or analogous as we can by program, and then by software, I mean, and then we're going to have research assistants on either team help with the other policies that don't overlap so easily, and that will be done manually. And as Cindy said, it's going to be done country by country. We're starting with 2 countries in different geographies of the world that one that CoronaNet has very granular data for, and one that we have very granular data for, using those as kind of our test countries.
Yeah, maybe. Thank you, Sophia, Emily, and also Angelique. It's also for us, like we figured out this is super challenging, the integration, because it's not only different taxonomies, but especially it requires a lot of country knowledge, because of like if we imagine a policy that has started, then being updated, had an end date or haven't had an end date. And so like this complexity can actually only be solved by like with a country knowledge. So we really work closely with our research assistants and work hand in hand in order to make sure that this, like the policy that we integrate into our data set, really fits into this whole set of policy mix that is present in the data in a country.
Shall I hop in? So Oxford's, I'll tell you sort of very briefly 2 stories of incorporation. So we started off working with the University of Sao Paulo because they were already coding, I think 3 of our indicators subnationally in Brazil before we got very far with it. And so from that, we then set up other units, another university in Brazil and in Oxford as well, to cover the rest of the indicators. And that initial kind of toe in the water of collaboration really showed us both the opportunities and the challenges of it. And just to give you ideas, like I completely agree with Luca about country knowledge, because you know, in a country like Brazil, you can have quite conflicting rulings from the judiciary and from the government, right? And so you've got to have you've got to have across your team, even if it's teams in 3 different locations, similar interpretations of how you deal with that, which often go beyond the standard codebook that you can write for the entire world. And then we've also collaborated with the University of Toronto, and as per the University of Sao Paulo, they were interpreting our codebook as you can either code the policies put in place subnationally just by the level of governments, say you're coding a state or a province just by the provincial government, or you can code all of the policies, whatever the level of government, that apply geographically in a unit. And so, you know, we didn't explicitly say that in our initial codebook, and yet we found that other people had gone off and they'd interpreted the opposite that we were doing. So we then had to think of ways to impute and come out with essentially the same interpretation or different forms of the data that we call total and gov, basically. So, you know, we've been feeling our way, and, you know, I think that's why we need big conferences like this, basically, so we can go through the processes of feeling our way.
Great. Yeah, there's another interesting question by Christina, and like there are many questions. I hope to like that we can rush through some of them or most of them, but I would like to get an introduction or just some few words from everyone on this question from Christina. Would be interested in hearing any perspective that participants share around the strategies to support staff doing this type of labor-intensive work with the absence of a clear end date. So what are our strategies and challenges and experiences? Maybe Angelique, you can start again.
This is a very good question, because that was actually one of the biggest challenges that we faced, especially at the beginning. An interesting story is that when we started the data collection, we were only 4 people, myself and 3 other analysts collecting the data. As you can imagine, very quickly we got very, very tired during the data collection because it's such a labor-intensive effort, and at the same time we were building the analytical framework and trying to also reach out to users and promote the dataset. our strategy on that was to expand the team. This we were able to do very quickly through our cooperation with different universities, and mainly the University of Copenhagen, that provide us with a lot of volunteers. And then expanding this with different universities around the world, trying to access and build also more country-specific and regional focused skills and knowledge, and to build also the language skills of the team collecting the data. In my opinion, the data collection is almost impossible to be a full-time job, exactly because of the of how intensive it is, and the attention to detail and the constant concentration that is required to be done in a correct way. And that's why we had set up a rotation system where groups of people, and that included volunteers, but also our analysts working on the data set, would cover similar countries, the same countries, by more than one person. And then we would have this conversation also taking place, but also double checking and confirming and correcting the data.
So on our side, at the very beginning of the project, in the emergency phase, we had a lot of collaborators in many countries, like a bit more than 40. And our strategy, my strategy, was to be connected with all of them, to know them by their name, what they are doing, where they were living, and to encourage them as much as possible. Communicate a lot: Skype, telephone, emails, Slack. And then we switched to another strategy where we pay 3 persons, and then they work full time. But as you said, it's very hard work to do it. So we have planned 3 to 4 months, and it's now 4 months for this work full time. And again, trying to connect 2-3 times a week, and yeah, encouraging them because they do an amazing job, and it's a hard job. So yeah, I think we base mostly our strategy on communication with the volunteer.
Yeah, also for us, communication is a key part, and we think that in order to motivate people, it is really important to know about the why we are doing something. So at the beginning it was pretty clear, we are doing this to collect data in order to make it possible to do real-time research on what are effective policies and what are not. And like, because this is an ongoing pandemic, like, our next promise we made to our cohort was, okay, we are trying to make this really a global effort by reaching out to all the other trackers and merging this project. So I think, like, providing the why to why we are doing this, and why research assistants should be really like spending hours and days and weeks and months to ramp up the data. This is like a crucial question of motivation. And also we try to emphasize this community aspect. So we are having a working paper series by which people can publish their own work. We have country notes. We show them how to use R, have a teaching platform. We have different kinds of tasks and subtasks by which we can give more responsibility to them. And like, all of this project wouldn't work without this multifaceted team of like people from 18 time zones. And this is really amazing and astonishing. And the more like, or the longer this pandemic goes, we really see the need for funding, because it is not really like, it was so hard for us to apply for funding and to get some of the funding, but still this is not enough. And we are all also here to maybe brainstorm together on how we can also get some money for our research assistants together. But this is up to the next weeks of discussion. Sophia, do you want to say something about your strategy, or?
No, I just wanted to address one of the questions that Olga had asked about
shall we give Oxford people first on this question, and then, okay, great.
Okay. Yeah, I mean, the core of these efforts are keeping the volunteers motivated and happy. And I think you know, other people have really captured a lot of the main things that we've been doing as well. And again, so yeah, being really responsive and good communication. We have WhatsApp groups that function as giant help desks in effect, and we have fantastic research assistants that man all of these things, so people don't get frustrated and, you know, they don't have to go away and come back and do their coding the next day. We have we try and make it fun. I think that's one thing that is really, really important. So when we've been allowed in the UK, which is not recently, we've had sort of picnics in the park, socially distanced picnics, and we've had people, you know, bring a friend on their phone who's in Nigeria or wherever it is coding, which has been great fun. And then, yeah, we try and we have our coders produce research notes, for example, for some of the subnational districts and regions of the world. And we've got things such as a data visualization course that we're setting up for them. So yeah, we try and help where we can with just people's sense of motivation. And there have been waxes and wanes in our volunteer army. I think for us, it's been more of a case of the academic year. So when the exams were approaching, Tom and I were slightly in fear of what that might mean for our coding effort, because at that stage, so many of our volunteers were students taking exams. But I think as the longer this goes on, the bigger the challenge will be, probably.
Great. So yeah, there are some shorter questions I would like to just read out and let the people who feel they would like to add something to this respond. Babita Gupta asked, several interventions were introduced globally to protect, maintain and expand health workforce capacity. Do any of the trackers capture health workforce surge capacity and safety interventions?
Do you want to mute? Okay. Is there feedback? Anyways, okay, yeah, we do capture information on, I sound like God right now. Yes, okay. We do capture information on whether there's been resources given for hiring doctors, nurses, other health staff, volunteer health staff. And I think some of this information might capture what you're trying, what you asked, but it doesn't exactly capture what you ask.
Shall I hop in quickly? So yeah, we have an indicator about in emergency investment in healthcare, which can be, and it's an amount of money, so that can be hospitals or whatever. So it's not quite as nuanced as I think the question is asking about, but it gives you something to go on. And then in the notes for that indicator, that will stipulate what the money is actually for.
We also capture data on how many, not how many, but if there's measure to employ health staff, or if some intern are employed longer, or something for the nurses, or yeah, we also have it. No number also.
I don't believe we have a lot of policies on this. We're more focused on public health policies non-related to clinical staff, but we do have sections for other interventions that are not listed, under which volunteers could code a policy related to medical staff. We just don't have a specific question for it.
Great. So Moritz asks if there are any efforts automatically classifying texts into the policy measure categories to partly automate the identification of policy measures. I believe CCSL mentioned something on that.
So we do not automate the process, we do it manually. It's a content analysis strategy, and this is done manually, but maybe Luca, you would like to answer this question, I think.
Yeah, I mean, we do, like, as we said, we are cooperating with Overtone, who provide like an information on policy, like policy announcements itself, but not tweets. But we also had a like a cooperation with JetAware, who were doing, had an algorithm that gave us a list of newspaper articles in order to track those. And you will see there, like in the next session, there are people from WN Track and other, like from IBM and other trackers that are using semi-automatized ways of collecting this data. So I would probably wait after this presentation to talk a bit more about it. But also, Alex, if you would like, I don't know.
Yeah, I was just going to add on that. We've also been thinking about using Twitter to analyze kind of like the rhetoric behind the data, so how it's communicated from policymakers to the public. But the issue with Twitter is, first of all, there's a lot of noise. So by noise, usually in like data science or epidemiology, we mean like, how do you identify a valid signal? And then also it's just the sheer amount of capacity you need, or you need really good. And I think that's where we have to think about in the future how to collaborate with private sectors or experts in the area of machine learning or deep learning. Because to be fair, in public health, at least, not many people are trained in that area. And yeah, it's close to impossible to do that as a human being because you have to be on Twitter all day.
Okay, great. I can see there are 2 more questions. One is about how you can actually reach out to collaborate with any tracker, and the other is if there was any effort made to figure out a common identifier for the data. I know that also, for example, the PHSM people will have a short presentation soon, so I would put these questions, or June, if you allow us, to have these questions raised at the 3rd session. So we make a short break of 10 minutes. In the meanwhile, I'm going to give every presenter of the other trackers now the right to share their screen and be a discussant, so to say. In case I forgot anybody by 5 p.m., please write me a text message or mail so I can add you to this. And we see each other in 10 minutes. So welcome back, everyone. The thing is, as I said, it's the first webinar we have, and so there might be some technical issues in allowing people to speak and so on and so forth. So just talking a bit about what we are doing now. So you have seen the presentations of some trackers, but there are many more, and we have more than 15 trackers that have participated. I wasn't able to find all of them in the chat or via Zoom. So if I miss someone, I will just speak out the name, and if you say, oh yeah, I'm here, then I will add you to this. Also, I hope that you can share the screen. If not, just let me know, and I think I can easily fix that. Every tracker, because there are more than 10, I hope 15 trackers, will have 3 minutes sharp to present their project. This is because we want to have an ongoing conversation and discussion also afterwards, where we can raise questions, etc. pp. As we figured out the last time, it might be really good to open the chat to everyone, and you should do this. You should be able to chat with each other right now. This wasn't I didn't know that this was possible, so now you can chat, and please use the chat. We will nonetheless have this Q&A afterwards. So please just let us know if there's anything you would like to add. Otherwise, we are going to start. I got the Bogachichi University presented by Ceyhun Elgin. I haven't found him. So please just send me a mail, and in the meanwhile, we will continue with the Canadian Canadian Institute for Health Information. Should be Christina. Can you see us, Christina?
I can see you, and I've just.
Can you share your screen?
Let me try. It says you've disabled it.
Okay, this is nice, but I will give me a second. I am able to do this by making you a co-host. Yeah, just write in the chat or in the Q&A to the others if I haven't added you. This was not meant to be like this. Okay, so Christina, Now you
Now
should be
I
able.
seem to be able to share my screen.
Yes.
Can you
Excellent.
see it?
So
Perfect.
wonderful. Thanks a
I
lot.
have 3, so I'll go because I have 3 minutes, right? Okay, so thanks very much. I'm Christina from the Canadian Institute for Health Information, or CIHI, and today I'll be presenting CIHI's COVID-19 intervention scan for Canada. Can I advance my slides here? Yes. So just by way of background, Canada has a population of 38 million and our healthcare system is federally funded. So the federal government gives funds to our 10 provinces and our 3 territories who are then responsible for delivering and managing their own healthcare services. So what is CIHI and what do we do? So CIHI is an independent, not-for-profit organization. We hold 28 pan-Canadian databases, and our goals are to provide high-quality data and standards, to deliver analytical tools that make it easier for people to use our data, and to produce reports with actionable analysis. Our vision is better data, better decisions, healthier Canadians. To support Canada's COVID-19 response, CIHI began tracking health interventions that directly impact spread and outcomes related to COVID-19. Our scan's an Excel document that we have offered in English and French, and it includes detailed information on government interventions at the federal, provincial, and territorial level. Municipal level interventions were considered out of scope, but they might be included in the scan if they're announced at the provincial or the territorial level. Our first public release was in June, and our next update is February the 18th, but we do make English-only versions of the scan available to interested researchers ahead of time. So we spent a lot of time considering how to classify similar interventions, and we settled on the 11 categories shown here on the left. We've further broken down these into intervention types, which I'm not sharing because of time, but you can find all the information in our data dictionary. In terms of our process, we update the scan on a 68-week cycle, and currently we have 9 staff participating. And new as of this update, we're very excited to be collaborating with CoronaNet. So I'm going to go through these 5 phases here. So first, in the planning phase, we update our instruction document. This is when we brainstorm expansions based on what we know about current events. For example, in this update, we added a vaccine category, and here we really benefited from CoronaNet sharing their early work developing a vaccine taxonomy. The scanning phase is the most resource intensive, and here we often encounter challenges around how to categorize new entries in a way that's intuitive for an end user. And we also have discussions around scope and deciding what's relevant, because in order to maintain consistency across Canada, we need to have a strong rationale for everything we include. And because our taxonomies are very similar, we're now collaborating with CoronaNet on scanning for some jurisdictions. In the quality assurance phase, each team member fact checks other members' jurisdictional files and conducts consistency checks to ensure we're collecting the same level of detail and that we're using consistent language. And then we submit for editing and translation into French. On an ongoing basis, we're tracking our digital downloads, and we're also looking at our feedback from stakeholders to understand how they're using our data and how we can improve. And we're also continuing to review scope and our resources because, as you all know, as we've discussed, this is very time-consuming work. And finally, we've developed an interactive tool that displays the scan in a user-friendly and streamlined visual timeline, and I've included a link here at the bottom. So thanks very much. Hopefully that was 3 minutes.
That was quite excellent. Thanks a lot. If you mind stop sharing your screen. So now I can see Ceyhun Elgin from the Bogachichi University. I'm super sorry for not pronouncing this correctly.
No, that's perfect. That's perfect. So let me share my screen very quickly. Okay, so our policy tracker, our tracker is related to COVID-19 is basically a tracker of economic policy responses that the governments, national governments all around the world have taken towards mitigating the adverse effects of the COVID-19 on the economies. We are doing it with Gökçe Başbu from Sungkyunkwan University from South Korea, and Abdullah Yalaman is a professor of economics at Eskişehir Osman Gazi University in Turkey, and I am at Boğaziçi University in Turkey. So it's basically a tracker of policy responses, as I said. We started to collect the data in late March 2020, shortly after the WHO has declared the epidemic or the outbreak as a pandemic. And we are keeping track of fiscal policy measures, monetary policy measures, and balance of payment measures of national governments. Fiscal policy measures, we are keeping track of it as percentage of GDP, at size of the package as percentage of GDP. For monetary policy, we have 3 main variables: which are the policy rate cut, percentage cut of the ongoing policy rate compared to February 1st, 2020, which is before the pandemic has started. Similarly, cut in the reserve requirement ratio again as percentage of the ongoing rate in February 2020. And macrofinancial packages size of the macrofinancial measures, which is again denominated as percentage of GDP. And then for balance of payment measures, we are again keeping track of it as percentage of GDP since March. Since March, we basically had 14 versions of the data. So we basically kept track of all these measures at 14 different time points. The first version corresponds to March 25th, and the last version corresponds to November 20th. Currently, we are updating it one more time, and the new version is going to come soon, a few days later, hopefully, by the end of the weekend, as the 15th version of our data set. How we keep track of it? So we are basically, all of us are trying to use several different data sources to get the necessary data. Our primary source is the IMF's policy tracker website, which is a screenshot is available here. This is just for one sample country, Armenia, which is again similar to us, dividing these policy measures under 3 categories: fiscal measures, monetary and macro-financial measures, and balance of payment measures. This is our primary data source. However, this is not enough because that tracker is far from being perfect. That is why we are also using additional data sources, such as websites of the national central banks, news outlets, Bloomberg websites, etc. There's also a tracker by ILO, International Labour Organization, which is the country policy responses of all the ILO members in 3 different national languages, official languages of the ILO: English, French, and Spanish. Again, we are also using that, but this is also not enough. So we are using national newspapers, national TV channels, national websites, central banks website, etc. To gather this data. And as I said, we basically now have 14 measures, 15 one is coming shortly, and we publish each most recent measure on a separate website where we cite our original paper and the last version of the data, along with a map of the most interesting measure out of our data set.
Thank you really much. This was awesome. And I'm super sorry that we need to stop you, kind of. I hope that it is fine for you and don't take it personally.
Of course. No.
So the next person I do have on the list, Nicolas Lazar from the COVID Border Accountability Project. Nicolas, you should be able to share your screen now. We can't hear you if you already talk.
Yep, I am definitely on mute. Sorry about that. Hope y'all are having a great day. So excited to be here with the COVID Border Accountability Project. Essentially, we've really focused in on travel and immigration border policies in response to COVID-19, gathering a scope of over 240 countries across the globe, and across those gathering just over 1,200 border policies from those countries. And so what we've done is we've turned all of these border policies into this interactive public map tool, in addition to publishing our data on GitHub, with the idea being that there's a lot of folks that can make really great use out of kind of just the raw data. But for the general public, we thought it would be a really important and really impactful opportunity for us to make some kind of data available to them. And so this provides a timeline of how border policies have changed over time. In particular, as you can see in red kind of up top, particularly before and after the World Health Organization declared the pandemic. And as you can see here, we find that kind of the overwhelming majority of countries do end up shutting down almost completely their borders. So no travel in or out of the country, etc., with just 8 countries really not even having a policy at all. And one of those includes Antarctica, for example. So most of these are very niche kind of areas of the globe. And so we were thinking that our data provides kind of 2 key uses, first in the social sciences, second around public health. In the social sciences, thinking about kind of what is the effectiveness of a travel policy in response to a viral outbreak? How does a differing regime type lead to the likelihood that they're going to enact a complete versus a partial ban? Thinking about health, we'd want to take a look at the impact of versus land versus sea versus air restrictions and see if one is particularly more beneficial than the other in stopping the spread of COVID-19. in addition to doing the same work with a complete versus a partial ban, etc. I believe that should have been 3 minutes-ish. So that's all I had for y'all, but thank you so much.
Wonderful. Yeah, so just if you have wondered why the recording was stopped in the meantime, due to the settings, you are like all the people who are presenting are at the same time co-hosts, so you have a lot of power. So please don't use this power to do something bad. And let's have the next tracker. I got the COVID-19 European Regional Tracker, but actually I'm not. I didn't find Asyad Naqvi. So maybe if you are still there, write me a message, and then we continue with the COVID-19 policy tracker represented by Lun Liu.
Hi, can I share my screen now?
You should be able, yes.
Yeah, I do. Do it quickly.
Yes, the 3 minutes are yours.
Can you see my screen now?
Yes.
Cool. Hi, I'm Lun Liu from School of Government, Peking University, and I'd like to present a PHSM policy tracker at the regional or say subnational level developed by my team. Our tracker follows exactly the format and taxonomy of the WHO PHSM policy tracker, which is actually composed of the big trackers in this conference. And we complement the policies at the regional level. The motivation is that we aim to identify the effect of individual PHSM policies, as several groups are trying to do. So we need to know as accurately as possible what PHSM policies were in place at different localities. And subnational units, including states and provinces, are the level that PHSM policies are most usually made, such as the US states and Japanese prefectures. So we build on the WHO PHSM datasets, and we aimed to provide a full record of the PHSM policies issued at subnational levels in Brazil, Germany, Japan, South Korea, UK, and US, which are 6 countries, and they are 2 countries in Asia, 2 in Europe, and 2 in America. The time coverage is from the onset of the pandemic in each country to August 2020, which is the end of the first wave of the pandemic and first wave of the lockdown policies. And we listed around 900 policy items, which can be downloaded from our website shown on the right, which is www.citiesandregions.cn. And the organization of the work was like a 2-layer system composed of 7 students to do the initial collection, and mainly by browsing the various government websites, as many groups have done, and then 2 graduate students in my group double-checked their work by spot-checking the web page links they provide and cross-check the info with news reports and so on. And challenges we identify, I believe, are similar with the experience of the other trackers, such as the interpretation of the policy. For example, some policies of Japanese prefectures read like requiring people to stay at home or closing the businesses, but actually this is without legal power, so it should be interpreted as a recommendation. This is also the kind of problem that previous groups have mentioned as the country information, country knowledge. And this is a kind of problem we find harder to identify than other kind of mistakes. And for the next step, we aim to transform the previous information into a more readily analyzable policy timetable so that researchers can directly analyze the evolution and impact of PHSM policies. This new data form is under development, and this is how it looks. We have detailed policy types as the columns and regions and rows, and then in each cell is the evolution of that policy in that region, which can also be easily further processed into numeric codings. And in the end, we welcome cooperation in developing this form, and we're also open to be merged to any big trackers and any other similar efforts, since the point of the work is to share. And thank you.
Thank you, Leo. This was amazing. Now I got I got the COVID-19 State Policy Project presented by Christopher Adolf, and I think it's Christopher you're presenting, or your colleague, Megan?
Yes, it's, I'm presenting with Megan Erickson, and Megan is going to start. I'll share my screen.
Hiya. Hi, so we're the COVID-19 State Policy Project, and we track state-level policies across the US. We're based at the University of Washington, and we were initially a volunteer team, though since then we've been able to secure the funding to allow us to sustain this project for almost a year now, and you could find the list of people on the team cited at the top of the slide. So the policies we track across the US include mask mandates, stay-at-home orders, quarantine orders, business bar and restaurant restrictions, and gathering and travel restrictions. And for these policies, we track when they're issued and ended, and also when and how they're extended, eased, or expanded in this time. And we track these policies at the sub-state level, such as by county, when they're coordinated at the state level. So for these policies, we include machine readable characteristics. We track whether they're formal mandates or recommendations with geographic scope using county lists to accommodate sub-state tracking. And we differentiate the level of business restrictions from like takeaway only to indoor allowed, and numerical gathering limits for indoor and outdoor social and religious gatherings. And lastly, we differentiate the level of mask mandates, such as limited, broad indoor to broad indoor and outdoor. So here you could see a visualization of one way our data could be utilized. For example, we could see the mask mandate levels that states adopt and the variation in time they implemented these policies.
So thanks, Megan. We recommend that users of our data set focus on our very detailed beta data set, which you can find at the same GitHub site. I've shown just a small picture of that data set. It has over 11,000 separate entries at this point, tracking policy amendments and extensions across these policy areas for each of the 50 states and the District of Columbia. Each step is traceable backwards and forwards as part of an evolving policy chain. So here you see bar restrictions in California as they've changed from takeaway to indoor only, depending on counties and dates. How do we do this? Like others, we're doing frequent policy scans, in our case daily, of official state sources, including executive orders and public health orders. We are not relying on media reports primarily to avoid some of the issues in misreporting or vague reporting that we've seen in the media. And we use substance expert knowledge to distinguish which things are mandates and recommendations and so forth. We have a two-step process of entering and checking across our team, and we have broad team discussion of edge cases and revisions, and we upload weekly to GitHub at covid19statepolicy.org. We face a challenge that everyone does of maintaining objective, real-time, machine-readable coding, given the evolving policy frameworks that each state keeps rolling out, different ways of doing things. And this causes a costly continuing realignment with new policy dimensions, things like phased easing being implemented in different states, curfew regulations appearing, religious exemptions and spreading. We also face the issue that websites evolve and sometimes policy documents disappear, so it's critical to grab those, and we have an archive of all policy documents going back to the beginning of the crisis. We face, like many, the challenge of a lack of established funding sources for policy trackers, so it's been a real scramble to keep this project going, but we are at this point going strong basically a year into this. Thank you.
Excellent, wonderful timing as well. So next is the Eurofund, represented by Christine Omaya-Pintar. Are you there, Christine? If yes, you're muted.
Yes, I am.
Yeah, we can
I was trying to share my presentation at the same time. Can you see my presentation?
Yes, we can.
Okay, thank you very much for inviting me to this conference. So I wanted to talk about our new COVID-19 EU Policy Watch database. And before I start, maybe a few words on Eurofund. We are an EU agency, a tripartite EU agency. So we have the governments across the EU and the social partners, trade unions and employers organizations in our board. So our main research interest is to look into the social partners' role in designing and implementing policy measures. Our tracker contains the major government policy measures in the EU. It contains collective agreements, bipartite or tripartite, some social partner initiatives, joint or unilateral initiatives, and examples of company practices, how they deal with mitigating the social and economic impacts of the crisis. To date, we have a bit more than 1,000 cases in the database. And when I talk about cases, in our case, these cases are relatively text-based. So there's a lot of descriptive information on each case, brief background and context, then something like eligibility criteria, etc., which is also updated regularly on a quarterly basis. And then we have information on the take-up of the measure and on the effectiveness, if that's already available from, mainly from government sources usually. And then we're particularly interested, as I said, in the social partners' views and in their involvement on the measures, to what extent they were being only informed about the measures by governments, to what extent they were being consulted, or even if they came to negotiated agreements with governments on the content of the measures. And then we have a set of nominally coded variables, including 10 main topical categories. This ranges from all the employment protection measures, like all the short-time working schemes that you see, that we saw popping up during the crisis, income support schemes for other persons not covered by short-term working schemes, any measures to help state businesses stay afloat, measures to prevent social hardship, etc., and divided by another 40 subcategories, all of them single choice. We have also information on funding, whether it's national, EU, or regional level. We have information on target groups, including a detailed breakdown into businesses, different types of businesses, different types of workers, and different types of citizens. Information on the actors involved, government, NGOs, social partners, government institutions, information on EU country and region at the NUTS 2 level, and sectoral and occupational information. You can find our database online, either if you go to the overview page as an HTML database, where you can enter the detailed description of the cases. We also have a dashboard online, which has some detailed search options, and we also give access to the raw data set via JSON files. And the data collection is mainly based on a collection from our network of correspondents. Sorry. Yeah, so network of correspondents, they are research institutes across Europe, and we are regularly doing a centralized quality control. Maybe the biggest challenge is the question on how to delineate a case. So much from my side. Thank you very much.
Let's talk about this, especially tomorrow when we talk about taxonomy. I'm sure there will be spaces to talk about it. Now I do have the presentation by the Tracker Institute on, they have the coronavirus announcement tracker. This is represented by Annika Stobart. She is in Australia, so she sent me a video, and I hope that when I share this, everything works. So give me a second.
My name is Annika Stobart. I am coming to you from Melbourne, Australia. I work as a health policy researcher at an independent policy think tank called Grattan Institute. My policy tracker began in March last year when my team of 3 people were publishing on and modelling COVID-19 policy responses. So I first set up the tracker for our team to help our research, but I very quickly decided to make it public. It's the only policy tracker for COVID-19 that I know of in Australia. So it's mostly been my work. Every morning I wake up, make coffee, sit down to work at home, and start trawling through government websites trying to look for recent policy announcements relating to COVID-19. I'd summarise them and then put them into the tracker. So I thought I'd run through what it looks like. So firstly, this is just a screenshot of what the tracker looks like. It's a Google spreadsheet, fairly simple, accessed by anyone, but I'm the only one that can edit it. So let's run through a bit more detail, because I know it's not very easy to see. So there in the first column, you've got the date. So each row represents a day. Then after that, you've got the cumulative case number and the daily new case number, so you can see how that correlates to the policy announcements. After that, you've got columns for each major policy streams. They cover border policies, both national and interstate, health policy responses, welfare policies, social distancing restrictions, business support measures, school closures, and announcements around schools, policy specific to Indigenous Australians, and then also a bit on the policy announcements by our central bank. Zooming in more closely, you can see here you might have multiple policy announcements on a given day. So I would summarise the policy, and then in bold there you can see the letters refer to the state or territory in Australia. So NT, the first one, is stands for the Northern Territory, and then the kind of category that of announcements. So this comes under the welfare column, and then the domestic violence is the category. And then down the bottom, I had two different tabs, one for the national government and one for the state government announcements. The national government and state governments have different responsibilities related to COVID-19, so I thought I would separate them out to make it a bit simpler. And we have 8 states in Australia, so the state tab was quite busy. So at any given time, there were usually between 10 to 30 people viewing it. But usage was correlated to how bad the outbreak was at a given time, and obviously how many announcements were being made. I got thank you emails from a large variety of people, including NGOs, journalists, businesses, and it was also used by public servants who were looking at policy decisions at other governments. Just run through what how it was used for us. We published a number of newspapers and reports and summarised the policy tracker in a number of different ways. So firstly, this is one snapshot. It doesn't show the case numbers, but it's a good snapshot of the first 6 months of our first wave last year, categorised into those 4 categories on the left-hand side. And another use we had for it was looking at how the decisions tracked against the outbreak, the case numbers. So you can see the kind of decisions there in grey against the case numbers. So just in closing, and next time I will probably share the workload with colleagues, promote it more and track more the usage of the tracker itself, and maybe have this more interactive dashboard. Thank you very much for having me, and I look forward to the rest of the conference.
I hope you all understood everything. This was quite nice. And now I got the IAE Paris, University Paris, and Simon Pocher will present their work.
Hi, Luca, everybody, thank you. So I'm going to present the tracker, which is called Response to COVID-19. And indeed, that's a project that is funded by my researcher at the University of Yale Paris, and that's the University of Paris Panthéon-Sorbonne. I just want to say a shout out to the research assistants who helped me in coding the data. So Oriane Maillefranc, Lorena de Michelis, Léa Reville, and Aziz Goumeri. I'm just going to present really briefly the data, and then I'm going to show you the website, which is more interesting in the couple of minutes that I have. So we're coding on a daily basis information by hand for more than 200 countries, actually 220 countries, for both public health measures and economic measures. We rely mostly on different secondary sources, so the ACAPs, for example, and I'm very sad to learn, I learned before that they stopped coding the variables, but we relied on ACAPs, IMF, the UNESCO, ID, which is an NGO for elections postponing, and the IGC, the International Growth Center, which codes data on economic measures. First, the dataset was first released in April 2020, then published in Scientific Data in November. We have 13 public health measures. I'm not going to list them, but it's pretty standard: mask mandate, restaurants closures, school closures, election postponing, which is doesn't appear in so many other trackers. And we have 3 scale measures, no measures, partial. Partial means regional or for single category of the population, and strict measures. And we have 7 economic measures based on our reading of the IMF website, credit schemes, wage support, cash transfers, and so forth. Right now, actually, we are giving a greater focus on the economic measures to catch we started collecting the amount for the OECD countries and trying to extend the collection of amounts. I'm just going to show you the website, which is pretty much better than my presentation, actually, if you want to have a look, and there's a link to the GitHub. So as you can see, the website is like that. We created some global public health measures index and index. You can also, zoom on some of the policies, and you can play, for the public health measures and the economic measures. You can just play it and see how basically the diffusion of policies all around the world for the global index or for the different measures taken. So that's all I wanted to show, and happy to discuss it tomorrow and the next days.
Excellent. Thanks a lot. And now I am going to present the work from the International Network for Government Science Advice. Some know it as INGSA. They are situated in New Zealand, so this is a reason why they can't join today. But I know that Tatiana Buklias will join tomorrow when we talk about the taxonomy. This time I'm going to read out loud their presentation, and I hope that I will make everything right. I hope that you can see this, and I will start. Please remind me if I'm over the 3 minutes. No, I'm joking. So the International Network for Government Science Advice, INGSA, based at the University of Auckland, COI2, the Center for Informed Futures, is an international collaborative platform bringing together policymakers, practitioners, national academies, scientific societies and researchers to build capacities, share experiences, and develop theoretical and practical approaches to the use of scientific evidence in informing policy at all governmental levels. It was established in 2014, and over the years before the pandemic, it organized capacity building workshops on evidence to policy conferences and funding ECR in low and middle income countries. In addition to the Secretariat in Auckland, it has also regional capacities and chapters in Asia, Africa, and Latin America. In March 2020, INGSA launched a COVID-19 Information Hub with Evidence to Policy Tracker as its part. Leveraging INGSA's 5,000 strong membership, the project team recruited volunteer rapporteurs from across 118 countries to track government-led responses to COVID-19. The nature of INGSA and its research interests have dictated the focus on evidence and justifications behind the responses. This focus is what distinguishes the INGSA tracker from other initiatives of this type. This work was funded by EDRC, Wellcome Trust, and the WUN. The attached short slide set explains the core elements and working principles of the tracker. So here, I think you can all see this. Next, while tracking effort was going well early in the pandemic, we have found maintaining the pace difficult. We have a small core team, and Tracker was conceived as a tool to support the core interest in science evidence advice rather than a project on its own. We are currently involved in 2 international research projects, the International Public Policy Observatory, IPPO, and Evaluation of Science Advice in Pandemic Emergencies, ESCAPE. We are also funding 6 researchers from LMIC to work on country-specific projects. As we develop these projects, we are trying to understand whether the best way to support them is continuing with the tracker or finding alternative forms while supporting other tracker projects by giving them our data and access to the volunteer network. As we all figured out, I should never become a news TV moderator, but I hope that everyone got the most out of it, and Tatiana will also be present tomorrow. So I now have Ian Orton from the ILO, but I haven't found him. So in that case, I would just skip to the next one. And if Ian, if you are there, just let us know. Next one is the Ox COVID-19 project presented by Adam Mahdi.
Hello, everybody. I am here. I will be sharing my screen and very briefly let you know about in a few words, just describe the project. Let me just share the screen. Okay. Can you see the slides?
Yeah, the 3 minutes are yours.
Excellent. So would like to talk just in a few words about the Ox COVID-19 project. It consists of two main parts. There's a database, which is basically 90% of our work, and there is also a tracker. So we have a web page. You can check this out at COVID-19 at ENG Ox AC UK. This is based at the engineering department at the University of Oxford. Now, what was the goal? What did we want to achieve? We started our work around the end of February, maybe beginning of March, as we realized the data was at that time quite a lot more difficult to come by than now, and we wanted to. So we do not collect any data, but we wanted to merge different data sets on different administrative levels. So we created a sort of key and spent quite a bit of time to try to merge different modalities of data: epidemiological, mobility, weather, many countries' statistics. We have around 200 gigabytes of data. And how do we do this? We have our system architecture is sort of it's quite automated at this time. So we fetch around 70, a bit less than 100 sources, and we try to assign them this unified geographic key that each different modalities of data can be queried in the easy way. Tables can be sort of joined, and once the unification took place, we have a validation part. Then we store our data in Postgres SQL database that you can all access at this time. We also have a GitHub. When we put all the CSV files, the related CSV files on the GitHub, at some point we will take away the Postgres SQL access, and we will have just only API and CSV files, and that's our goal. But at the moment, you can access the whole database and query using SQL, or just download the CSV files. So what do we achieve by that? Pretty much, this allows us to focus on certain regions. It could be on the country level, but also on subnational level, and query different modalities of data at the same time for a given geographical location. This is done basically. This is in geography. This is quite a huge task. We use GADM nomenclature, and we use their sort of division to incorporate and to encode to different modalities of data. And this is pretty much it. Thank you.
Great. Wonderful, Adam. Thanks a lot. And now we have the UNDP Women COVID-19 Global Gender Response Tracker, represented by Isuna Dugarova. Adam,
yes, hello everybody.
You need to stop sharing this.
Hi.
No, I think Adam needs to stop sharing his screen so you can share yours.
Yes, I'm trying to stop sharing my screen.
But while Adam is stopping sharing his screen, I just want to take this opportunity to thank you, Luca, and all the organizers for this conference. I think it's amazing that we brought all of us together and we can find synergies and complementarities. I think it's all very impressive and exciting. So thank you so much. And now let me share my presentation.
Thank you for the kind words.
Right. Okay. So colleagues, so my name is Isuna Dugarova. I'm a gender specialist at UNDP, and I'm very happy to represent our core team from UNDP Young Women on our effort to create this COVID Global Gender Response Tracker. And I know my colleague Constanța Tabus from Young Women here as well, so we're happy to address any questions you may have. So this tracker has been co-created by UNDP and Young Women. We launched it in September 2020 at the General Assembly. And the purpose of this tracker is to monitor and analyze policy responses to the COVID pandemic from a gender perspective. And at the moment, we are looking at the design rather than the impact, but we are thinking about how we can move forward with the measuring impact. So the focus of the tracker is the government measures at national, federal level. In some circumstances, we'll look also municipal and local levels if they have a strong gender dimension. In terms of sources, as with many other trackers, we use existing policy trackers, but also we have direct submissions from governments who write to us and provide information. We use public data, and also we have our country offices in over 100 countries who help us to validate and support our efforts. This is a living database, and we continue to update with new measures, and as I will share later. This is the landing page of the database. So far, we actually, as we launch, we have over 2,500 measures, but now we have over 300 measures in 206 countries and territories. So what we do, and you see this kind of analysis we provide here. So by green are the measures that were identified as gender sensitive, and gender sensitivity we analyze by applying 3 analytical questions in terms of whether those measures address women's economic security, whether they support unpaid care work, and address violence against women. So in terms of the next steps, we are currently updating the database, and we are planning to launch the next stage in March for Commission on the Status of Women. And at the same time, we are updating the database with data on women's political participation, particularly in COVID task forces. And as we move forward, we would like to add digitalization, green recovery, and also some other dimensions, but this is to be confirmed. And in terms of the data collection efforts, so we have a core team of 6 people. We also have support from over 60 UN volunteers to whom we provide trainings. And what I want to add in terms of challenges as we move forward and try to join forces. So one is we would like to find ways to automate data collection and transfer. Second, as I mentioned, we hope to find the ways to measure and analyze impact of those measures. And thirdly, we want to find better ways to capture changes in policy responses, because so far we kind of see these trends. On the one hand, we see a kind of shift from emergency to recovery, but at the same time, we also see that some countries instead of policies identify ways to do this, and we're happy to collaborate with other colleagues to do this together. Thank you so much.
Thank you, Isuna. This was great. Okay, we do have 2 presentations by the WHO. As far as I understood the email correctly, the first presentation is held by Tanya Schmidt and Olivier Lepoulain. And the second one is then about the WHO Public Health and Social Measures data set by Chris Grundy.
Thanks, Luca. I'll start it. This is Olivier Lepoulain from WHO in Geneva HQ, and then Tanya will follow on. So I think you can see we can see the screen here, so that's perfect. So I'm going to be very brief. It's been great to see all the different trackers databases presented here. From our perspective, just wanted to flag the sort of global database, which is on our website. It's a database which LSHTM are compiling and collating, and we'll have a presentation by Chris Grundy later on that. And it's a sort of collaborative collection of different databases for everyone's download, of course. And it's a way as well for us to do some own in-house analysis about different measures. If we go to the next slide. This is just an illustration. Japan was taken for no particular reasons, but just to say that from a policy angle, from our perspective, one of the questions we of course always are being asked is what measures work, how well do they work, when do we need to implement them? And so having very detailed databases about the various measures that are being implemented is useful to enable researchers to disentangle those effects. So we've got a guidance on how to adjust public health and social measures for various levels of transmission, for various contexts and epidemiological contexts. And we are on a regular basis producing some descriptive and more analytical outputs of the kind you can see here, and also liaising with academic groups and other partners externally to try to improve our understanding of how measures work. I think in general, one of the challenges is not only just to have good data about the measures themselves, but also adherence to the measures and the coverage of those measures. And I think that's where also linking some of the other data sources and social science looking at adherence is very important. Just to flag that the visualization you can see here will soon also be adapted into a global dashboard, and that dashboard will present a range of public health and social measures, when they're being implemented, when they're stopping, when they're introduced, and look at that also with in the context of the epidemic dynamics, and so the epidemic curves. It's not going to be exactly as it's shown here, but it will be close to that, and related as well to more regional dashboards. And Tanya will present the one presented for the or put in place for the European region. So with that, I'd like to finish and pass over and hand over to Tanya.
Thank you, Olivier. I hope you're able to hear me. So I'll just say a few words about the PHSM dashboard that has been developed in the WHO European region and the corresponding database that feeds information to it. So I'm here presenting on behalf of the PHSM team. We're based in Copenhagen. We're the regional office for Europe and tracking PHSM responses of all of our 53 member states in the WHO European region. You can see the map here displayed on the slide. We've been collecting PHSM measures since 27th of January in real time, following the WHO PHSM taxonomy and glossary. And as of this week, we have collected over 15,000 measures. A big part of it is related to travel and trade restrictions that especially recently have increased. Quite uniquely with our data set is that we do feed it back to our member states. So we share the information on a weekly basis, and then also a public version which is the Euro PHSM dashboard. In terms of the quality of data, and maybe this is a little bit how it differs to some of the other trackers, we do receive official reports from ministries of health, from our country focal points, diplomatic missions on response measures, especially those that interfere with international travel and trade. We also receive intelligence from our WHO country offices, situation updates, so that makes the database that we manage very much coming from government sources. So this is the main source of the data. Similar to others, we have developed the severity index, which is a compound score composed of the average severity of measures that are listed here on the right side, including mask policies, school closures, business closures, gathering restrictions, domestic movement restrictions such as curfew, stay-at-home orders, and international travel restrictions, which also includes testing requirements, quarantine requirements that have increased recently. Very quickly, yes, I just wanted to show the screenshot of the dashboard. So this is available for each country, where we plot the epic curve to the measures and to show really the relationship between the two. So this is available, the link is here. We also produce several trend analyses, policy analyses that are also available here on our Health System Response Monitor website. And I'll stop here. Sorry for
I'm so sorry, but
yes.
I'm sure there will be much time also in the following, like tomorrow, but also in the following days when discussing this in detail. Chris, are you there?
Yes, I am.
Great. So go ahead.
Okay, let me just find my presentation. Okay. Okay, so I'm going to talk about the public health and social measures data set that we've been collecting with WHO. We've come at it from a very different angle from most groups, in that we believe that collaborative data collection is the way that we have to collect data, especially in major emergencies. We started in March last year, and in April we had a meeting between the major trackers where we learned about their data that they're collecting and discussed collaboration. So instead of collecting our own data, what we do is we take data from the other trackers and bring it into a common framework. This should result in far more comprehensive data sets. We have two different data sets, a fully coded version, which currently includes the trackers from Oxford, ACAPS, Johns Hopkins, CDC, and we're in the final stages of looking at incorporating WHO Europe. And this means you can go into the data set and look at all of these trackers in exactly the same format under one common taxonomy. The second level of data we have is where it's being transformed into a standard format, but not yet fully coded. And we have data from Vienna CSH, WHO IHR, and World Food Programme in that. And we're currently just restarting looking at how to work with a CoronaNet. And the ultimate aim is that all of these will be available in a standard format under the standard taxonomy. In the fully coded data sets, which so are sort of four main trackers, we have over 100,000 records, of which 55,000 are unique, and we cover 228 countries or territories. One of the main strengths of this is the WHO taxonomy, which was developed in consultation with other groups, and it's based around existing taxonomies for influenza-like illnesses. There are categories, subcategories, and measures. There are 7 major health categories. And then there's another category which we added to, because we didn't want to get rid of data that other groups were collected. And then we've also got some administrative ones, which contain my favorite measure, which is never happened. Just to show you, one of the strengths of the methodology can be seen when you actually look at some of the data sets. So these are the data from the 4 providers which we currently check, clean, code. And the grey areas highlight the records in their data sets which are unique. So these do not appear in other people's data sets for that particular time. Now, you would expect this to be a lot less than it actually is. You can see this ranges between 53% to 71% for the different providers, which shows us that for any particular data set, we're not perhaps collecting as much as, everything as we would like. And all of this is available through the WHO website and through GitHub from the London School of Hygiene. And allows not just use of the trackers, but you can compare how the different groups display their data and record their data. So we know for every duplicate in each record, who else shows it, how they've coded it, their links, their comments, and all stuff like that. And I'll end there. Thank you.
Thank you, Chris. Amazing project. So we come to the end. Last but not least, Divya Pathak will tell us more about the WN-Track tracker by IBM. I hope you can share the screen and everything works. Great. Oh, sorry, it is Ching who is Chu. I'm really sorry. But now the stage is yours.
Hey, you can hear me and see my screen, right?
You do.
Okay, so this is Qing Hui, and I'm presenting on behalf of my wonderful colleagues at IBM Research. And then we are coming from a slightly different angle. And today, because given the time we have, I only want to focus on one very particular areas. And I do encourage you to check us out at the ibm.github.io/wintrack. That is a public-facing website where we share all of our data set and all of the code that I'm going to mention today. Okay, So the key differentiator of our project is we are a group of data scientists with the expertise in NLP. So the key problem we are trying to solve here is we all know that data collection is a very, very labor-intensive problem. And then we all lack of the number of volunteers to help us do this task. And what we are trying to do is how can we leverage what's already out there and also use AI and machine learning, natural language processing to make sure that we don't depend that heavily on the human annotators. So the first thing that we do is instead of going to all those news resources, we use Wikipedia as our single resource, and that can be changed. We just use that because Wikipedia normally already have a lot of volunteers. And for example, each COVID page by country usually have dozens to hundreds of people working on that. And then starting from there, we extract those data, we crawl that data daily, and we run our own natural language processing unit. And at the end, we only need a small, much smaller number of people to validate what's already being pre-processed by our NLP component. And then this is just a slide to show that right now we are very focused on, so the things that we capture are very focused on the containment and closure policies. But the whole system and the methodology I'm presenting here is generic, and that can be applied once we have a new or consolidated taxonomy, and we can apply this whole process and generate the NPIs on this new, based on the new taxonomy. And we are happy to work with each and every one of you. So do check us out. So here is one example. So if you get something from Wikipedia, and then what we do is we extract that and we run our NLP and we identify basically where it happens and when. And there's a polarity, and we have a key value pair to capture what it is. And so this way we can consolidate all the evidences and group them into one single NPI. So as I said, this is based on a bird-based deep learning model, and all the code is shared in our GitHub. And here's another example, because I think all of us know that if you see there's NPI and there's something announced, the policy announced, and they are often reported by many, many different news channels, and they are paraphrased, but at the end, they are all about the same thing. So a lot of time we try to visualize this and we count the numbers of NPIs. And then if we are not careful, we may double counting a lot of that. So this is one simple example showing that all of this reported by so many different channels, they are really talking about one thing. So we really need to separate what is the evidence of NPI and what is the NPI itself. So this is just a very high level workflow. So basically, yeah.
Last sentence would be great.
Okay, yeah. So we start from Wikipedia and then we crawl that nightly and we run the NLP component and we have a simple curator and then we can visualize all that. So do check this code out, and then maybe this code will help you in collecting your data set.
Amazing. Thanks a lot. And I mean, I didn't believe this is going to happen, but we made it right in time. So this is super. And although we write in our program that we directly go into the next session, I would just give us a 5 minutes break to pause. There is so much wonderful information there, and I'm super thankful for having you all and presenting your ideas, and one can really see the ideas of collaboration sparkling in everyone's head. So let's take 5 minutes break, and then Alex is again taking over moderating a session, and together with Lucas Lehner, who will be a speaker. Excellent. See you in 5 minutes. Great. So welcome back. I will hand over to Alex and to Lucas, and it's nice that you are still here.
Thank you, Luca. Lucas Lehner has kindly agreed to give an overview and an assessment of how the trackers have presented their data so far in the conference. To give him a brief introduction, he's from the Oxford Super Tracker, He's a DPhil student at the Department of Social Policy and Intervention at the Institute for New Economic Thinking at the Oxford Martin School. His research fields are comparative political economy and labour economics, applying microeconometric and experimental methods. So take it away, Lucas. Thank you.
Thank you, Alex, for the very kind introduction. And I'm just going to share my screen. And I think you should be able to see my slides now. Let me check.
We do.
Wonderful.
Yeah.
You can confirm, did you see my slides?
Yeah, that's fine. We can see them.
Excellent, thanks. So thanks a lot for the opportunity. And it was such an interesting afternoon already, well, afternoon in my time zone. And the idea was just that I kick off our group discussion between all the trackers now by giving a very brief meta-level overview on the field of policy trackers, how it has evolved since the start of the pandemic. And probably all of you are more experts than I am on tracking policies, which you're doing in the policy trackers. What we are doing at the Oxford Super Tracker is to track you guys, to actually collect the policy trackers and just have a directory of them to have an overview. And so it's great to meet many of you eventually, since we have been in touch with many of you as well. And so I will just give a brief 2-minute overview on our project and the collection itself, and then share some macro level views on the policy trackers, which is really just to kick off and motivate our discussion. This is joint work with Bernhard Ebbinghaus, who is also present in the meeting, as well as Elias Naumann, Mary Daly, Merrick Nanzig, and Tim Flanders from Oxford and Mannheim. So, great. So I'm just going to give a very brief overview on the directory and then talk about how the supply and demand of policy trackers has evolved and what opportunities, challenges, solutions that may entail for us that we can then discuss in the group discussion. So many of you may know the directory. You can search policy trackers by title, policy area, focus, country coverage, data format, and authors. And what is interesting about it, maybe its history, which shows the potential of swarm intelligence, because it really just started off with a tweet last year in March, when many of you were actually hard working on actually collecting policy trackers. I was just looking through them and shared 4 of them initially on Twitter. Within a few days, that received suggestions for dozens of additional sources, and the collection grew soon over 100. And first I moved it to a static GitHub web page, at that time organized under Tracker of Trackers, which some of you may remember. And we received an overwhelming interest, and thanks to Bernhard and colleagues at the Department of Social Policy in Oxford, we established soon after that the Oxford Super Tracker, which is this dynamic website where you can also submit the data sources. And since then, we've received many submissions of additional data sources that we are constantly trying to integrate and update the collection. So thanks to those of you who have submitted their data, be it on Twitter, email, or via online submission form. If you'd like us to update the information on your projects, please just reach out to us and submit the updated information via the submission form. Or if there is a more special request, just drop us an email and we'll be glad to update it. So it's really a story, and I think learning effect of swarm intelligence activated by social media, which allowed us to produce this public good with many contributors. And it was really helped and promoted a lot by word of mouth, and that made it possible to establish this collection. In addition, Elias Naumann at the University of Mannheim has complemented the policy tracker collection with a collection of population surveys that relate to COVID. And we know of several researchers who have used the policy tracker directory to identify sources for interventions. And complementarily, the survey directory on the same web page to identify sources for outcome data, for example, to evaluate the impact of the interventions, of the government measures. So we've used the collection to provide an overview of sources in a policy brief, and we are currently recruiting a research assistant to update the collection and will extend the short analysis. We also have a monthly newsletter where we introduce policy trackers each time in a different field, in case you're interested. So let me talk just a bit about how the field of policy trackers has evolved to motivate our discussion. Almost all of your projects have started with the pandemic, most of them at least. And you can see here that the demand for policy trackers has really soared since the start of the lockdowns in Europe and in North America. And the COVID-19 policy trackers provide an immensely valuable public good by enabling comparative, but also causal social research and informing evidence-based policymaking. And so from looking at the demand for it, let's move on and look how does the supply is distributed across the different providers. So most of the policy trackers that we collected, so it's of course not we cannot claim that it's extensive, but we try to include any source that we learn about and that fits in. So about a third of the policy trackers come from academic institutions, which are fairly largely represented at this conference, over proportionally, and about a quarter come from international organizations, then followed by NGOs, think tanks, and some sub and national agencies. Global companies are also leveraging the rise of big data to create trackers on key issues, such as we've seen the presentation from IBM Research just before. And the first initiatives focused on border closings, social distancing interventions, but also labor market interventions such as short-term working schemes or interventions to deal with financial market turmoil. And soon the field expanded very rapidly in March and April, as you know, and when many of your initiatives were born, and allowed for cross-country comparisons to provide evidence to policy decisions. Some trackers really cover broad areas, as we've seen in the presentations today, such as macroeconomics or social policy or public health measures. Others are narrower and provide more detailed information on specific areas, such as there are some which have very specific but very detailed information, such as, for example, a tracker on postponed election dates, a tracker on school closings, or a tracker on prison riots due to the lack of protection of inmates. Many go beyond public health and social measures. Some specialize and focus solely on tracking changes in for example, in the operations of tax administrations, or others in patent offices, so very narrow ones across countries, while others document, for example, media reports on the pandemic and actions of NGOs to uphold civil rights. Several projects also go beyond the national framework, such as a tracker, for example, on food export restriction, or a tracker on European solidarity, or others on diplomatic relations. Some try to capture, for example, the impact on wars and diplomatic relations, or on capital flows and donations between countries. Now, over time, the number of policy trackers really exploded in March and April up to May. And from June onwards, we could already see a decline in the active number of trackers when some of the small initiatives already dropped out. And since the summer, the field is actually narrowing down rapidly. And we will soon add another column to our database where we indicate which trackers are still active and which are not. So this makes the conference today and tomorrow even more urgent and important to explore enabling collaborations to continue the policy tracking. Now, how are the trackers covering countries worldwide? The vast majority, over 2/3 of the trackers, of policy trackers included in our collection, have a global scope, although many of them do not systematically cover all the countries, right? Many of the, even of the global trackers cover most of the countries, but not all of them. Now, generally, English-speaking countries are covered strongly over proportionally, while the global south is less well covered. Around 15% of the trackers focus on certain global regions and continents, and around 1/5 of all the trackers are specific on countries in our collection, but again, over proportionally on Anglophone and European countries. Several of the trackers are very detailed in tracking their developments in the United States, where they can be disaggregated up to often even very, very small scale level. But beyond the United States and some of the larger Western European countries, the disaggregation is not, there are not as many trackers that provide high quality disaggregated measures. Some of yours do on a comparative country level that were presented today. And I think also that's one of the points we should focus in the discussion today and tomorrow. Now, before starting our discussion, I just want to briefly come to the opportunities and challenges that arise out of this exercise. The public provision of all your data sets of the policy trackers allows for almost real-time access to relevant policy measures, for very important for researchers and policymakers on their informing the decisions of decision makers. And it also leads to an increase in transparency of the measures between the countries, between the region, which hopefully can contribute to increase their effectiveness. And I think that's one of, and that goes beyond the theme of our conference, but basically to evaluate the impact of these new data sources on policy decisions, which was certainly large in some of the cases. Now, these large data sets freely available to the public are also an immensely valuable good because they, in a way, make accessible information that previously needed a lot of capacity or financial support for research projects. And research projects often only publish the data sets after they publish the findings, which, contrary, the policy trackers make this information upfront available and therefore broaden the access to information, and more researchers can actually use it very, very soon. All these different policy trackers also have the advantage that they allow to compare information of different sources and triangulate the information across them. And they allow for different research designs, right? Some of them are set up for comparative research between countries, between regions, while others, for example, have a strong focus on the time dimension. Very often, the public health and social measures trackers have a strong focus on the time dimension, right, to allow for causal, quasi-experimental research designs. But that also leads us to the challenges, because many of the different projects operate under different, have different approaches to research, and therefore not all of the sources are compatible. And coordination between the trackers may help us, and that's what we want to explore in this conference. But it may also be inefficient, especially at an advanced stage of working on the data sets, because it actually may, in some cases, may raise more issues and effort than it has benefits. Now, we still have a number of challenges, and just to point out a few more, the scope and the validity of the data in some cases is restricted to the capacity bottlenecks of data producers. The comparability and combinability can be limited due to the different conceptualizations and data structures. Now, as I said, the field is narrowing down rapidly, and that's what makes it even more pressing to ask the question how to continue the data collection effort with a high quality standard. And I think that's just some of the questions that we should be discussing now and then continue tomorrow. And that's how I now hand back to the moderation and look forward to the discussion with all of you.
Thank you so much, Lucas. That was a really interesting presentation. So we now move on to our last session of the day, which is a Q&A session running until 7 p.m. CET time. So we've got some time to have a fairly open discussion we've written some discussion points which might be interesting to discuss, but we want it to be a fairly open discussion. But some things we might want to include are typical challenges that we have all shared in our data collection efforts, how those challenges might have differed between different trackers, and how they might have been solved differently between different trackers. Also, it would be interesting to hear about the things that trackers want to achieve but haven't so far, their ambitions for the future, and how those could be made to happen. But as I say, it's a fairly open discussion, so please go ahead and comment in the Q&A if you've got any questions, or trackers speak up if there's anything you want to raise. Perhaps we can start with the questions that are already in the Q&A. For some reason, Zoom is really small on my screen, so if you see me squinting, then that is why. But the first question that's been raised is, in order to collaborate with any tracker, is there any specific platform needed to be set up prior to the collaboration for data collection? So I guess I can start by responding from ACAP's perspective, though Agliki or Steve, feel free to add on to this. So I guess there's two aspects to this question as I see it, one being data access, for which a platform isn't needed, it can be just accessed from our website. And data collection, personally, I didn't think we had any specific software platform for collecting data. Data was collected through Excel. So nothing in particular that has to be downloaded. In terms of collaboration and collaborating with other trackers, I know that's Indy and Luca, you've done some work on this too, but some groups have looked into comparing data sets using platforms such as RStudio to analyze the differences in structure between different data sets and how those could be combined or compared. That seems like a common one. Is there anything else that anyone would like to add to this question as well?
I think we can, but Emily, do you want to go first? Okay, then I do. I think, yeah, so this is super crucial, as also Lucas, I think, pointed out. So we have existing trackers and they have different taxonomies. And what we figure out is that actually taxonomies are more or less easy to map, so to say, that you have the broad categories. But then it really depends on the different subcategories that are different in each data set. And we are going to integrate different data sets into ours. And as we said, not just merging them together, but following this line of how policies developed over time. So this requires an in-depth understanding of each country. And as such, we would love if you could reach out to us, or if we can discuss this together in the in the Slack channel that we are going to put online after these first 2 days, so we can think of how can we actually collect data together. For example, you could also imagine, and this is something for discussion maybe also tomorrow, that we also share the collection of the data, as such as that we have one kind of port to call where you enter different data, and then in the end every data set makes usage of this policy that has been indicated as new. But these are different kinds of things that we can discuss. And I can see Chris Grundy has raised his hand.
Yes, I mean, just on that, I think, you know, as a group that brings trackers data into one format, it is definitely more efficient going forward to look at collecting into one central tracker and then building value added onto that. So, you know, if you would take someone like the Oxford group, who could use a central data set for all the actual measures in place, but then build their stringency index around that data, rather than trying to do both parts at the same time. And that would just be my view. It's much, much more efficient. And then plus we do have some translations, as I said, you know, we've done translations between the different trackers that we work with. And, you know, we're obviously happy to share that. And some of the trackers are getting feedback from us on mistakes and things like that, and tracking between them. Over.
Yeah, that's really interesting. Yes, also, I guess by combining efforts, well, this moves us on to another question about collaboration as well, but also, I guess, by combining efforts, that gives us many more resources to collect data in more detail as well, to collect data on like maybe a more detailed level than country level, say, or even to be more thorough in data collection. It gives us more room to like make sure that nothing is missed and the data set as a whole is more reliable and more like true, I guess, more representative. I can see that Olga has raised their hand. They've put a question in the chat. So, understanding of the pandemic has evolved over time. Do you think taxonomy should be the same throughout the entire period, or differ for stages? Like until June the 5th, the WHO did not recommend masks. That's a really interesting question, actually.
I can start maybe answering, because we have been changing our taxonomy through the last year, updating it around every 3 months, and changing the codes really for the whole data set, and the amount of work and the time needed for that is a bit crazy. So it's true that it's very hard now to use the same code with a new policy as it was in March, because last year, because the way that the interventions are implemented are really different. And now it's highly specific on the number of people who can gather, where they can gather, if they have to be seated or not. So the taxonomy may have to evolve, but it's very hard to change it completely. I think it should be adapted. Maybe the others do not share that, but changing it completely, it's hard, but adapting it maybe.
Yeah, that's an interesting point. And in terms of data analysis as well, I speak as a data scientist, so that's kind of my area of interest. But as a data scientist, what you don't want to see is a structure that's totally changed from 1 month to the next. Say, if you need some kind of continuity to like look at how things change over time, which is, I think, something of particular interest with this kind of data set. And also, even if you're not looking at things over time, you need like a large enough quantity of data to do more sophisticated analyses, which then becomes not possible if data sets have totally changed. So I guess it's a case of, like you say, adaptation and trying to maintain as much consistency as possible without compromising too much, like the information that you want to collect. Like, of course, we can't expect that we set a standard right at the beginning of the pandemic and nothing changes, because it's been a year of unpredictability and of things that have happened that we haven't expected. So yeah, I guess it's a balance of those two. Is this a question that anyone else would be interested in on commenting as well?
I'd be happy to if I have my hand up for that.
Oh, sorry, go ahead. Yeah, of course.
Yeah, so I've been working with the COVID-19 state policy tracker for the United States, which is just one country, but endless subdivisions. So we track 50 states and DC, and we faced exactly this problem. It's been probably the biggest labor-intensive problem we faced, which is that strategies have changed over time, multiple times across states. So you get hints that there'll be a new perhaps dimension of policy, and you have to make a decision about whether to start collecting those data, whether to start creating variables around it, or whether it's going to be important or not. So just to highlight some things to follow off of Amelie's point, initially, most gathering and capacity restrictions were based around sheer numbers of people across states. At this point, the vast majority are based around percentage capacity relative to some fire code restrictions, presumably a much less stringent measure, but it also is a dimension that simply has changed over time. Likewise, to the extent that there are numerical restrictions, initially they were broad across indoor and outdoor and religious and non-religious spaces. At this point, most states deal with those four capacity constraints separately. And these are things that over time we've had to make decisions about whether to get ahead of or to go back and essentially create additional variables to capture where the variation is. Otherwise, the things that we were coding before in a machine readable format cease to capture any interesting variation because states are no longer moving or developing policies along those lines. The advice I would give is not just saving all the original policy documents, but trying to, when initially coding these, capture everything that seems like it might be a relevant policy dimension in an annotated component of even a machine readable data set, so that it saves time if you have to go back and construct an additional variable. At this point, we have most of the things machine readable that we want in our data set, but there are things that we wish we had been coding from the beginning, but would be extremely hard to foresee. Last thing I'll highlight, there are areas where harmonization here are tremendously difficult. When policies vary across different business sectors, and the sectorization varies not just across countries, but across every sub-regional space, it's extremely difficult to keep track of these things.
I think Christoph said like almost everything, but just one thing to add there is in our observation, also the taxonomy or the things that governments have been doing have been getting more and more fine-grained over time. So like in the very beginning, they banned all travel to all countries, and then it's banning just one country or one particular region. For curfew policies, we've observed in some Eastern European countries, there are curfews for like older people on Monday, Wednesdays, and Fridays, and for other people on Tuesdays, Thursdays, and Saturdays. So you can really see that like getting this level of disaggregate or very fine-grained distinctions is really important over time, and that seems to be what governments are trying to do is create policies that are very, very detailed.
Thank you. Yeah, those are really interesting points.
Can I add a point on that as well?
Yeah, of course, go ahead.
Alex, I can't hear you. Oh.
Can you hear me okay now? Yeah. So I think there's sort of two questions here. I don't think the taxonomy is changing. We're not changing gatherings. We're not changing curfews. That's still a category in the taxonomy. I think it's the level of detail that you go down to, do you have subcategories of subcategories of subcategories? I think a well-defined taxonomy allows you to incorporate, to split it up to lower levels at a later date. I would really worry if people are changing their sort of, the way they collect gatherings information and taking gatherings out and changing it to something else. I mean, your taxonomy is really, major categories and then subcategories. And one thing I found when I've been looking through, I look at all of your data sets, is that we don't really know how things are going to change. And the comments that you all have are an important location to store this additional information. And some groups, the comments are very, very precise. So for instance, we've been working with WHO Europe at the moment, and their comment clearly states exactly what the category is, which is perfect. It allows us to exactly look. We could come back and look at exactly what the category is if we didn't code it fully at the time. So I think using those comments to properly describe it, not just I've coded this as 6C and not have any information, is a really important thing to allow you to look back and do other people to use your data on. So, over.
Thanks. Yeah, that's really interesting. And about the comments, I guess that, like a lot of things, is a balance as well. Like those kind of fields are difficult to analyze because they're more free text, but then if you look at them individually, they're really, really useful. So I guess, yeah, if you can like include information that would be in the comments in a more like rigid field, then it makes it more analyzable but less flexible. What you were saying links to something that Olga posted in the Q&A as well, which is about, oh, I think it's just disappeared actually, but I think they mentioned about whether you start subcategorizing at a later date, whether that undermines the how you interpret the data before that subcategory was introduced. And I think that's something that's important to be aware of, and maybe more linked to sort of how you communicate the results and like publicize the data set, and then make those changes really, really clear, and then how people should interpret the results in the context of those changes, so that to avoid, anything that's misleading.
I typed a response to that for Olga, so I'm just going to say quickly on that point. We've tried to go back and add those missing data, and you discover that that dimension that you've added, may have been somewhat active before, and it's only now that you see the importance of it, or that it's diffused. But I would add, this highlights, I think, the importance of a point made earlier, which is separating the tasks of collecting data and recording it in a simple format from constructing indices on the data, because you may discover that you're adding new dimensions that become the key to policy, and that may lead to new ways of thinking about different indexes you might construct. And if those two tasks are more separate, even in the same project, it makes it easier to do that in a way that doesn't make the project kind of incoherent or lose the ability to be flexible.
Thank you, that's a good point. Is there anything else that anyone else would like to add on to this discussion, or add on to this question? If not,
maybe I'll just jump in briefly on what has been mentioned by Cindy and others as well on the level of aggregation and disaggregation of measures. So just to add on this, what we observe when tracking the policy trackers on a meta level is that the new trackers being added are much more narrower, but more fine-grained trackers, right? So the trackers that started first tracking were this very broad level, for example, trackers on all non-pharmaceutical interventions or on all economic interventions. And then some of them, those of you that are here mainly, are continuing this tracking effort. But then also many new ones have evolved, and these are much more narrow and fine-grained. Some of them are here as well today. And I guess one challenge, though, is to think where is it ideal to integrate some of the finer ones in the larger ones, and where is it just more practical to leave them separately as well, and where to draw the line in between.
Also, that makes me think, the discussion of sort of categorization makes me think of the challenge of the introduction and phasing out of measures. At least that's the terminology that ACAP's used, and the inability to exactly line up those measure one being phased in, measure one being phased out, things don't match up like that. And therefore you get an accumulation over time, say, of measures when actually the situation isn't like that. You know, if you look at like the total measures imposed at one point in time, then it can be a bit misleading if measures don't line up exactly. So I don't know if that's something that the trackers would like to comment on as well.
I think the fading out policies are really hard to catch for many measures that have been implemented. They do not say, oh, we stop recruiting healthcare workers. So you don't know most of the time. And I think it's really hard to align any measures that has been implemented with the phasing out ones. We have difficulty with that. It's really hard for us.
And to add on that, I think we faced exactly that problem. When we started, we were only tracking the introduction of measures. When we started introducing the phase out of measures, we tried initially to match the initially captured measure as an introduction with a phase out. But in most cases, what we saw is that there was not a clear phase out of a measure, but most often there was a new measure that was replacing the previous one. And as the year went on, we started seeing more and more of that. And I think now we see it also on the subnational level happening the same, where measures that were introduced at the national level are then replaced by measures on specific regions or on specific populations, which is something that I'm not sure how we could track the connection between the different measures, but yeah, maybe there would be a way to do it not as a straightforward connection as an introduction or a phase out, but more of creating a network kind of measures that are introduced or replaced or somehow related. That would probably be more challenging also.
Or something like looking at it rather from like an introduction and phasing out of individual measures, but like a status of, say, schools being open or closed, but you know, that would also have challenges like the quantity of data you'd have to collect. I don't know if Oxford or Hit COVID would be interested in commenting on this issue as well, or CoronaNet maybe.
I'll jump in briefly if that's okay. I think actually what Lucas raises is a really important point. You know, I think actually, so maybe I should break cover as a reviewer to Amelie. So the Nature Human Behavior paper, I was the reviewer. And so I'm responsible for suggesting that you guys redo your analyses with the CoronaNet data. So, you know, but I think actually that point speaks to a broader question that we should be thinking about here, and that is, while consolidation has value, you know, only having, you know, there's also value in having more than one measure of the same phenomena in the world in creating robust results. So I think, you know, that consideration should be brought into the discussions. Just to speak a little bit to the issue of kind of how the different indicators have evolved over time. So yeah, we started really broad, and over time we have split some of our indicators into more nuanced indicators. But it's, you know, the biggest challenge is, I think, trying to anticipate policies before they become a common theme of policy, right? And that's a challenge we've all faced. This morning we had a big team meeting about a considerable increase in a whole bunch of indicators, which is very exciting. But again, it's this huge challenge of like, where do we need to add a lot of nuance
and when, and how much effort is that going to take? So yeah, I think I just wanted to broaden the discussion a bit, just to reflect on that broader point. I'm interested to know what you guys think of that.
Thank you. That's really interesting. And the point you raised about the differences between the data sets, I guess it is really interesting how things differ between the different data collectors, and they're all trying to take a very complex situation and put it into a box. So I guess there'll always be points where things could be improved, or things don't represent the complexity of the actual situation. But I guess what you hope is, if you run analysis on that data, if you consider using data from all of these sources, then you hope your results don't differ significantly between the different data sets that you use. Sorry, I think someone was interested in saying something there. Did someone popped up on my screen?
I was hoping to say something to Angelica, but I can.
No, go ahead.
So Angelica was talking about the challenge of recording or systematically reporting what we've referred to in our group as phased easing in regions. So you might have a national policy that is reduced region by region to different levels rather than simply ended, or in our case we have regional level policies that are then reduced in strength, or perhaps re-expanded at local levels in a coordinated way across those regions. So what it's happened in a lot of the United States is the state is saying, well, we used to say close restaurants across the state, and now they can be opened in these localities, these counties, but with different regulations in each county that we'll be updating every week. And so what we've tried to do to deal with this is assign each policy change an ID number, and then show how each subsequent policy either eases or expands or extends a previous policy ID number. So your idea of networks of policies, it's what we're trying to capture in our beta data set that I mentioned. And then to allow for policies to be modified at a lower level, if the policy only applies to certain subregions, we have a field that simply lists those regions. It's machine readable, and you can see at any given point which regions are under which stringency of policy. It does lead to a very complex data structure, right? It's not particularly flat, where each entry is linked to past entries and future entries and has some list of localities or regions to which it applies. But it's the sort of thing that I think we need software tools to better work with that kind of data that could then output flat output that says, okay, for each day, for each locality, these were the policies in place. But recording that is something that can be done without having to literally enter each of those cells by hand.
Thank you. That's really interesting. Did anyone else have any points to raise on this subject before we move on to a different question?
Yeah. So just a couple of words on how we do it. So I think that this issue of like a concrete example of maybe a government closes all retail businesses, all like hair grooming businesses or whatever, or like all gyms and all of that, right? Like they just close everything. And then at some point they reopen these things, but at different times. Like this issue is really difficult to capture. The way that we do it is that we, every time there's a reopening of one of those businesses that were previously all closed together, we end the original policy and start 2 new policies, one in which like for all the businesses that are closed, continue to be closed, and then another one for the business that has been reopened. And so it's really kind of labor intensive. I think this is the only this is how we've kind of dealt with that issue. The other side of this is, I think, just in general, finding end dates can be really difficult, right? So like there's no end date to a recommendation to wash your hands, or there's not really an end date for distributing masks, like 20 million masks, right? It just takes however long it takes. We've introduced a new field to sort of try and get at those distinctions, but happy to talk more about that tomorrow. I think Chris, stand up.
Yep, go ahead, Chris.
I was just going to say the way we've done it is we have a previous and a following field in our data set. And then we have targets. So the target, say for business closing would say something like hospitality or retail. We started off with more detail and we've got less as we go because we worked out we couldn't keep track of hairdressers closing versus barbershops closing, and it never works on a global scale. So we came up with a set of targets, and then we have a phase in and a phase out. So we have adapting, and we assume that right now when things open, that they tend to open with conditions in a lot of places. And we do link from one measure to the next, but we link within the general category. So business closures, you can see how that section is evolving over time. You can see whether they're introducing new measures, whether they're getting stricter, or whether they're starting to reduce them. But it's not specifically saying this policy is closing at this date. It's just saying right now things are reopening, or right now things are closing. Because we worked out we couldn't do it. It's just not enough, the way we collect, especially at a global scale. We're not getting enough information to keep track of whether barbershops are open or closed, because sometimes it just says everything and sometimes it says nothing.
Yeah, that makes sense. There's just so much information to keep track of. I guess that opens up the question as well, which I think will be discussed in more tomorrow, about collaboration and how collaboration could enable us to track those more detailed measures, and track the situation in more detail with more accuracy.
Ines had her hand up for a while.
Oh, sorry. Yeah, I've not really been looking at hands. Yeah, go ahead.
Alex, did you mention my name? Yes,
yeah.
Okay, thank you. Thank you, Cindy, for your attention to this. So, yeah, I want to actually also broaden the discussion a little bit and pick up actually on the point that Lucas made in his presentation. So the question that we were interested, and I would love to learn your experiences and practices, is about how we can measure, analyze, and evaluate the policy impact and effectiveness. Because I think it's great that we have all this data available, we make it public so that everybody can access, we create this amazing knowledge product and so on. But ultimately, what I think is that it's so important to have all this data and to think how we can use those data and influence policy making. So I was wondering if you have any experience on that, because we can obviously think together and collaborate, but this is ultimately what we are looking at. Thank you.
Yeah, thanks. I think that is such an important point, actually.
I just want to note for everybody that on the third day of the conference, we're going to have a specific breakout session for how data from the PHSM trackers is being used so far in research. So that'll be, a much shorter opportunity compared to the summer session to share and examine what various researchers or trackers have done with data.
Oh, cool. That's good to know. Do any of the trackers have any thoughts on that for the moment? Oh yeah, go ahead.
Can I jump in? So I'd be really curious to know actually how much time the rest of you spend behind the scenes advising policymakers directly. It's something that Tom and I and the rest of the team have actually spent a lot of time doing. Tom and I spend 2 hours a week with the Cabinet Office in the UK advising them And we hear it's really hard to track the impact. So today in Prime Minister's questions, I was sort of shocked to see that our travel, the Oxford Tracker travel coding, and where the UK was placed relative to lots of other countries, was suddenly brought up by the opposition. So these things often bubble up in a surprising way, and in terms of kind of how you get to know of their impact. But behind the scenes, you know, we've been, and our team have been advising people high up in the UN and so on, and writing briefs and so on for them. And I don't know at all if you guys have been doing that as well. I'd be really curious to hear what's going on behind the scenes.
For example, our paper that has been published has been presented in a government conference by my colleague Peter Klimek. So meaning that the government was considering the result and the importance of this data and of the analysis. So yeah, that was like a new thing also, that research paper are presented in government conference directly by the researcher. I think it's a new thing. I haven't seen it before, so yeah, that was new for us.
Yeah, I'm happy to just say a few words. So definitely nothing as structured as it sounds like your experience has been, Anna. I know in the very beginning of our project that some governments did reach out to talk about using our data, but there hasn't been, like, we don't regularly meet with policymakers like it sounds like you do.
Yeah, I can give a different view. We've been at the London School, we have a big mathematical modelling group who advise the government in various countries. And we've had discussions with them, or they've had discussions with us about things that they would like to see, or changes they would like to know, or how the policies that we collect, how complete they are, and what happens, you know, do we feel that using one group's data is better than using another group's data, or does our data give us more flexibility? So it's been quite interesting that we've been, some of the changes we've made to our data has been coming from the policymakers asking, how do we include this, and does this measure actually tell us what we should be looking at? And I think that's another interesting question about how you get that feedback into what we collect.
Thanks, that's really interesting. And I think that's a really good point to end the meeting as well, and it leads on to tomorrow and the next couple of days. I'm just looking at my clock and we're 1 minute before 7, so I think if we end now, then we'll be exactly on time. But thank you so much to everyone today who has contributed, to all of the trackers, to all of the presenters and the other trackers as well, and to everyone else who's been listening in and contributing to the discussion. It's been a really interesting day. So thank you so much for participating, and thank you again, of course, to Luca and Cindy for organising this whole conference and giving us this opportunity to discuss and share our thoughts and our successes and challenges so far.
Thank you, Alex. It was so nice really to see. I think at top we were more than 150 people joining this first day, and it's just super cool to have all of this coming together a year after this pandemic started. This was the first day of 3, as listed in the program. The tomorrow session will be just for trackers to talk about taxonomy and technical issues. But on the at the third day, which is at the beginning of March, we are going to become more concrete, in not only in terms of what we discussed in the last weeks by then, but also there will be people from the Johns Hopkins University, from the Periscope project, presenting some like ideas about lessons learned from the pandemic and how maybe to structure future data collection processes in the pandemic. And this will be quite interesting. And also, just as a small shootout, we have received so many requests for presenting concrete research with the data. We really envision to have this conference covering this in the next, so to say, second COVID-19 conference, which should take place in summer, where we have a big program and invite every researcher, scholar, and so on and so forth to present their research with our data. So I think that we already are aware of some of these research projects, but it will be so nice to see what comes out of it in the end. And I'm super thankful also, yeah, as you said, Alex, for all the trackers who joined, for the presenters, for Tim Büte, and also the Hochschule für Politik, who made this really professional presentation mode here possible. And yeah, I'm really looking forward to seeing you either tomorrow or at the 3rd of March. And then I hope you will have a great evening, morning, afternoon, wherever you are, and enjoy your day. Bye-bye.
Thanks, everyone. Bye.